If everyone could please take their seats, we'd like to begin. Good evening. I do need to tell you that the hotel has let us know that we need to be wrapped up by 10 o'clock tonight, so please be aware that that is the case. My name is Judy Bernice. I'm the Licensure Unit Manager of the Division of Healthcare Facility Licensure and Certification of the Massachusetts Department of Public Health. With me this evening from the department are Healthcare Facility Inspectors Lucy Cerrone, Deborah Farraher, Elizabeth Agababian, our Nurse Aid Registry Coordinator, and Julie Riley, our Licensure Unit Coordinator. If you do not wish to have your comments recorded, please be aware you may submit your comments by email to hfllicenseaction, all one word, at mass.gov, or by fax to 617-753-8089 by midnight tonight. The women at the table out front do have a copy of that if you didn't quite catch it. On behalf of the department's commissioner, Dr. Robert Goldstein, and our bureau director, Elizabeth Kelly, I want to thank you for taking the time this evening to participate in this hearing. The department is holding this hearing on UMass Memorial Health Alliance Clinton Hospital's proposed closure of maternity inpatient services at Health Alliance Clinton Hospital's Leominster campus in Leominster, Massachusetts. This evening's hearing provides members of the community with an opportunity to share comments or concerns on the proposed changes in a public forum. Please note, however, we are not able to answer questions about the proposed changes during this hearing. Before we begin, I'd like to provide a brief overview of the steps that will follow this evening's hearing. The department will complete its review of the proposed changes based on the comments received this evening and those that are submitted in writing to the department. Based on our review of the testimony presented today, the current utilization of these services, the capacity of alternate sites to provide the service, and other relevant information available, the department will make a determination as to whether the services to be discontinued are necessary for preserving access and health status in the hospital service area. The department will make its determination within 15 days of today's hearing. If the department finds that the services to be discontinued are necessary for preserving access and health status, the hospital must submit a plan for assuring access to the service within 15 calendar days of the department's finding. Based on our review of the plan which the hospital submits, the department will either approve or provide the hospital with written comments within 10 days of receipt of the plan. We will begin this hearing with a brief presentation from the licensee. Following this presentation, we will provide an opportunity for local or elected officials from the community to speak, and then begin calling on individuals who requested to make comments this evening. I will now ask Dr. Tiffany Simas to make a brief statement on the proposed changes. Following Dr. Simas, Dr. Charles Cavagnaro will give a brief presentation on behalf of Health Alliance Clinton Hospital.
Good evening. My name is Dr. Tiffany Simas, and I have the honor of serving as Chair of Obstetrics and Gynecology at UMass Memorial Health. Thank you for the opportunity to speak today. I would like to recognize several of my colleagues who have joined me tonight, including Doug Brown, President of Community Hospitals and Chief Administrative Officer for UMass Memorial, Steve Roach, President of Health Alliance Clinton Hospital, and Dr. Charles Cavagnaro, Corporate VP and Chief Medical Officer at Health Alliance Clinton Hospital. I would also like to note that Dr. Eric Dixon, President and CEO of UMass Memorial Health, is providing testimony on the DPH conference line hearing taking place simultaneously to this hearing tonight. I have lived in Central Massachusetts the entirety of my life. For over 20 years, I have worked as an OBGYN within the UMass Memorial Health system. My immediate and extended family live and get their health care in Central Mass and the UMass Memorial system. My entire professional career has been dedicated to obstetrics and gynecology and to the consistent, safe, high-quality, and equitable care of pregnant, birthing, and postpartum persons, their babies, and their families. I have been personally involved in efforts to sustain the Health Alliance Clinton Birthing Center for almost 5 years. Making the decision that prompted this hearing is not one I ever wanted to make. In fact, we made robust efforts to prevent it. Making the recommendation to close the unit was difficult and remains personally and deeply upsetting, even in light of it being the decision most aligned with consistent, safe maternity care for this community. Like many of our health system peers, we are experiencing unprecedented workforce shortages after the pandemic. Because maternity care is highly specialized, it has been even more challenging to maintain staffing of our inpatient maternity services at Health Alliance Clinton in Leominster. This includes not only nurses, but also OBGYN physicians and other clinical staff. This, along with the declining number of births at the hospital, severely impacts the sustainability of this inpatient service, despite significant resources invested over the last 5 years and our sincere efforts to maintain the unit. For example, we have made investments in recruiting, upgrading the physical facility, purchasing state-of-the-art equipment, training, and expanding patient offerings. After much consideration, we made the difficult decision to propose closing inpatient maternity services. As painful as that was, and still is, we believe it is the right thing to do in order to best provide services to all of our patients. In the weeks since we announced this plan, we have heard many say this proposal was financially motivated. It is not. We want to be unequivocally clear that this was a clinical decision based on our persistent struggles to appropriately staff the unit and with the knowledge that it will be harder in the nearing future. It should be noted that many of the losses incurred at Health Alliance Clinton will likely be assumed by UMass Memorial Medical Center, both hospitals being part of the UMass Memorial Health System. We remain committed to ensuring that our patients, the people of this community, have access to the high-quality healthcare services they expect and deserve. Our teams are in regular communication with other community organizations and providers in the region, so as to make this transition as seamless as possible for patients. As we are making every effort to work with our impacted caregivers to find other positions within the UMass Memorial Health System. We intend for patients planning to deliver at Health Alliance Clinton Hospital to do so through September 23rd. After the proposed closure, patients may receive maternity inpatient care at UMass Memorial Medical Center or can choose one of the other high-quality hospitals providing obstetrics within 30 minutes of Health Alliance Clinton. And now I'd like to introduce my colleague, Dr. Charles Cavagnaro.
Good evening. I'm Dr. Charles Cavagnaro, and I'm privileged to be the Chief Medical Officer of Health Alliance Hospital, a position which I've had for the last 5 years. I have extensive prior experience as a community hospital CEO, a physician group executive, and the Vice President for Medical Affairs. I've been associated with UMass and UMass Memorial Health in some form or another since 1982. I'm an internist and primary care physician by profession. I feel quite comfortable commenting on the proposal as someone who is daily involved with the workings of the hospital and the unit. Patients impacted by this closure can continue to receive their prenatal, postpartum, and pediatric care in the community. Additionally, Health Alliance Clinton's Hospital's emergency department in Leominster will continue to care for emergency labor and delivery cases when they arise, and we will continue to ensure staff are prepared to provide emergency maternity services. Meanwhile, continued investment in the North County community remains imperative. We have invested in a new emergency department, a new multidisciplinary clinic last year to better serve patients with chronic diseases, and a new extended care unit for patients. and a significant investment in a linear accelerator provided to targeted radiation therapy to our cancer patients in the North Central community. We also are assessing community needs to inform an investment strategy that will ensure health equity is prioritized throughout this transition of services and beyond. This will shape a significant investment in women's health through improving access and enhancing resources that support prenatal, postpartum care for mothers, birthing people, and infants. We are tailoring this investment to reduce disparities and focus on those in our community who are at most risk of negative health outcomes. In doing so, we hope to address needs that may include improving transportation options, reducing barriers to care, and enhancing community-based resources that provide culturally and linguistically appropriate and responsive whole-person care. Our top priority is always the health of our patients and communities. It's why we sometimes must make tough decisions like this to continue to best serve those who look to us for care. We promise to be transparent throughout this process by remaining engaged with our valued community members, and we will continue to focus on providing exceptional care now and well into the future. Thank you.
Thank you. We will now begin by taking comments from local or elected officials. Our first speaker will be Representative Natalie Higgins, followed by Senator John Cronin.
Good evening. My name is Natalie Higgins. I'm the state representative in the 4th Worcester District, which serves the city of Leominster. Just before Memorial Day, we learned that UMass Memorial Health decided to close our birthing center at Leominster Hospital. Our whole community wondered how this could even happen. Tonight, you will hear countless stories of how critical Leominster's birthing center is for hundreds upon hundreds of families that give birth here each year. These amazing nurses, doctors, surgical techs, and all of our labor and delivery staff save lives each and every day. According to hospital licensure regulations, the condition of licensure of acute care hospitals is approved by you, the Department of Public Health, based on, quote, the provision of community benefits, including the identification and provision of essential health services. This has me wondering how many essential services can be cut before our beloved community hospital is no longer a hospital. This isn't the first time we've been here. Just a few years ago, we were facing the proposed closure of our inpatient pediatric unit and our cardiac and pulmonary rehab at Leominster Hospital. Never mind continued cuts to Fitchburg's Burbank Hospital and Clinton Hospital. In that hearing, I warned DPH and the hospital that harm would come to families seeking acute medical care for their children, then to be faced with the impossible decision of how to care for your kids and access their medical care all the way in Worcester. We were also assured that there would be coverage for our ER by pediatric hospitalists as a backup, and they've begun to reach out to us to alert us that those positions are being eliminated as well. We know those promises and assurances made by the hospital during this process are just promises. To be clear, we're here fighting for our community. We're resilient. I like to think we're pretty scrappy in the best of ways, but that's because we've had to be. The proposed closure of the birthing center at Leominster Hospital feels like the final cut in a death of 1,000 cuts by UMass Memorial. If we cannot sustain birthing services for nearly 600 families, how can we truly preserve our community hospital? You will hear frustration from our delegation and local leaders in our community, all leaders in their own right, for showing up here today. The hospital continues to present us with rationale as to why they can't sustain these services. Rationales that we continue to debunk, from nurse staffing to birth rates to the availability of obstetricians in the Leominster community. We're looking to you, DPH. In light of the doubling of the severe maternal morbidity rates in the last decade, while notably, we let hospital executives shutter 10 birthing centers across the Commonwealth, to say enough is enough. We have to preserve these critical access points because in labor, minutes matter. 35 years ago today, my mom, Diane, who's sitting over there, gave birth to me at Leominster Hospital. Her first labor with me was relatively uneventful, if not unbearably long, as she likes to remind me. 2 years later, in 1990, After an incredibly fast labor, my mom gave birth to my brother and nearly died at Leominster Hospital. She wouldn't stop bleeding, and the incredible staff at Leominster's Labor and Delivery saved her life. My parents are here today with me because they want to make sure every family has the right to get these life-saving services right here in their own community. Thank you for your time.
Thank you.
Hi.
Senator Kernan?
Hi, good evening, everybody. And I will start really with two things, but I'm disappointed that the person that made this decision, that can reverse this decision, and is accountable for this decision, is not here listening to the community tonight. And I also want to thank the people who work in this unit and who have delivered exceptional care in labor and delivery for decades, to my family, to my mom, to so many families in this community, for being here and for sharing your stories. Can we say thank you to all of them? UMass Memorial has proposed to close an essential service that has existed in our community for more than a century. This is a drastic, tragic proposal for North Central's healthcare system, and one that generations of women and families will suffer the consequences of. The process by which UMass Memorial initiated this closure was a failure of its responsibility to our community. Process matters. So we shouldn't judge UMass Memorial's leadership decisions tonight by what they say. We should judge it by what they've done. And this region's healthcare system does not need and does not benefit from crocodile tears. We need partners who are committed to working with us in good faith to keep essential services open in this community. UMass Memorial's conscious, deliberate, and strategic choice to act in bad faith, to announce this closure the day before Memorial Day weekend, and on the day that the legislature was casting its final vote for the fiscal year 24 budget, ensured that our state delegation's hands would be tied to work collaboratively in good faith to deliver resources to keep this service open to our community and to keep labor and delivery viable. That was a choice. Since this closure's announcement, this delegation has sat across the table from Dr. Dixon and asked him a very simple question. What do you need to keep this service open? After all, over the last 2 years alone, this delegation behind me has voted for, fought for, and passed legislation that delivered tens of millions of taxpayer dollars, more than 80 million of your dollars, to stabilize essential services in the UMass Memorial system. During that time, we were in constant communication with the UMass team, but no mention of challenges to the labor and delivery unit was ever made. No mention of any consideration to close this unit was made to this delegation or local, state, or federal partners, even while we were delivering tens of millions of dollars to the healthcare system. So again, what do you need to keep this unit open? All of us should be really disappointed that we have not received a response. We deserve better. The decision to close this unit is not about declining birth rates. It's not about workforce challenges that we cannot overcome. And it's not about a deep concern for healthcare outcomes of the young women in our community. This decision is about money. And any other explanation from UMass Memorial is insulting. This decision is part of a concerted effort to provide less health care to poor people who live in Fitchburg and Leominster and North Central. In 2017, the labor and delivery unit was on more solid financial footing. 62% of North Central residents that gave birth in Leominster were commercially insured, which is reimbursed at a 50% higher rate than Medicaid payers. 5 years later, the commercial payer rate is 25%, and the Medicaid payer rate closer to 75%. So by closing service in 2 gateway cities, UMass will shed Medicaid payers from North Central as those patients, those women, most of them minorities, most of them poor and Medicaid payers, go somewhere else outside, to Emerson or St. V's to get health care, or Haywood. And so to Dr. Dixon and the UMass leadership team, if you believe that this analysis is untrue or too harsh, I would just ask you, please don't conduct yourself like a bad actor in the future, and you won't be treated like one.
Thank you, Senator. Next is Representative Michael Kushnerik.
Good evening. Thank you for having me here this evening. You've heard from just 2 incredible champions on healthcare and healthcare equity. You've heard about the history of healthcare consolidation in this region. Fitchburg used to have a hospital, Burbank, on the hill, where so many in Fitchburg were born, and the surrounding community. At one time, this region boasted 3 hospitals between Fitchburg, Clinton, and Leominster. And over the course of the past 20 years, you have a history of broken promises and service consolidations that have gutted our communities and gutted our healthcare access and outcome. And behind each consolidation, they told you, our promise is to increase healthcare access, health outcomes, to save lives, and that by centralizing services in one hospital, it'll benefit the entire region. That sounds like a beautiful promise. That sounds great. Except for we have a track record and 2 decades of broken promises to this region. Each time they come before you, DPH, and promise an essential service consolidation plan and mitigating factors to ensure that access to care and health equity, within 3 years, they've reversed course. The same plans that they proposed are no longer valid or in play. And just years later, those same services are often then consolidated right to Worcester. So what we have is 2 decades of service consolidation, and it doesn't just deprive us of a convenience. It doesn't just deprive us of access to our own community hospital and to our own regional pride and the help for a regional economy of having robust health care and the opportunity for young families to come to our region. Though those are important, what it does do is it impacts those most socioeconomically disadvantaged in our community. This is an incredible region. We have 2 gateway communities. We have some of the most urban environments in Massachusetts, and we have some of the most rural environments in Massachusetts and everything in between. We're incredibly proud of that. And these service consolidations affect each population constituency quite differently. But speaking for both the rural and the urban, I can tell you that this impacts both greatly. And I think that this healthcare organization has repeatedly shown that they don't care. They'll tell you that they're an organization dedicated to health equity, to health outcomes, and health access in their community. Yet, they're yanking away those very services and access to our community. And when that happens, particularly people of color, those who speak another language, those with physical accessibility issues, those are most impacted. So 2 gateway communities, the one Fitchburg that I represent, was always serviced by Burbank. And what we saw when they consolidated to Leominster was people, though they were promised access to Leominster, they often were left behind. They had issues accessing public transportation. They couldn't pay. They couldn't find childcare coverage or family coverage, transportation. And so what it did was made an already difficult task that much harder. And yet here we are again. And now I'm left trying to explain to a single mom of 2 who lives on an Elm Street in Fitchburg without transportation of her own, how she's going to get prenatal care in Worcester every 2 weeks. She won't, is the answer. What's going to happen is that she'll say, I'll get the next one. And then 2 weeks later comes, and she still doesn't have child care coverage, or her work wouldn't give her a day off to be able to get non-existent public transportation between Fitchburg and Worcester, I might add. And so what suffers is the mother. What suffers is the child who is yet to be born. And then what suffers is the child throughout his entire life, because healthcare conditions that could have been addressed during the prenatal phase are now having to be addressed throughout the lifetime of that individual. And I realize you have the impossible task of looking at important data and trying to decide whether or not the data bears this out. And you're going to hear a lot of heartbreaking stories, and I implore you to listen to them. But overall, I can promise you that no matter what they tell you about ensuring transportation between Fitchburg or Townsend or Lunenburg and Worcester, that transportation 3 years from now won't exist. Those private OBGYN practices that are now based in Fitchburg and Leominster, they'll follow the hospital. They'll follow where they can admit patients, and that's Worcester. And so who's going to be left behind? It's our communities of color. It's those who don't speak English. It's those in our gateway communities. And yet again, gateway communities with already difficult access to health care, it's going to get worse. That impacts our communities. That impacts our municipalities. It impacts our economies. But it's just the wrong thing to do. For an organization that says they're about healthcare, they sure aren't acting like it. Thank you for your time this evening.
Thank you. Next, we have Representative Jonathan Slotnick.
Good evening. I will be brief. I hope that it is so painfully obvious that this is an essential service that DPH will have no trouble reaching that conclusion. So instead, I want to spend a moment putting some context for you of why you're hearing so much frustration from this delegation. And that's first and foremost because we have struggled over the last several months through several hours of meetings, poring over data, conversations amongst ourselves, to really understand the how and the why of this decision and why really is this happening to us. And to add to that, and Senator Cronin mentioned that Haywood Hospital, which is in the district that I represent, has been floated as one of the alternatives should this actually close. And I want to point out that I represent a district that is more rural, less affluent, and smaller than the communities we're here to primarily talk about tonight. And if in this region, North Central Mass, which is all in several 100,000 people, if that's not a big enough market to provide these kind of services in a place like Massachusetts, I don't know what's going to happen here. And so as you look forward and you go through this process, I hope that the first step in this in determining that this is absolutely an essential service will be the easy part. The hard part is what comes next. And as my colleagues have said before, and I'm sure will say after, we know that the fight continues beyond this night, and I thank you for your part in that work.
Thank you. Representative Kilcoin.
Did you say Margaret Scarsdale?
Oh, I am so sorry. The next name, I apologize.
That's all right.
I did not say that, and you are the next name.
Thank you.
My apologies.
No worries at all. Good evening. My name is Margaret Scarsdale, and I'm the state representative for the 1st Middlesex District. In November of 2022, Massachusetts legislators, including the delegation here tonight, voted to appropriate millions of dollars in taxpayer money to stabilize services, the delivery of essential services in this district, and voted to send that money to UMass Memorial Health. How much of that money was devoted to keeping the essential services of labor and delivery? Because we find ourselves here tonight discussing not keeping those essential services. And having been the beneficiary of millions of dollars, I'm struggling as to why Leominster Hospital and UMass Memorial Health didn't notify this delegation of such a major change. I heard earlier from UMass Memorial Health the comment to continue to be engaged. They weren't engaged in the beginning, so why should they be engaged now? The impact to the affected communities in this area cannot be overstated. Families in this region are literally going to be without labor and delivery services. And as much as we romanticize birth, it is a medical process that is fraught with risks, as the recent report from the Massachusetts Department of Health shows. That is a dramatic rise in serious complications from labor and delivery. Rural communities often bear the brunt of cost-saving measures. And in this case, the decision to close the labor and delivery unit in Leominster Hospital leaves family really with very few options on how to continue a healthy pregnancies, as the other legislators have spoken of. The lack of transportation, the lack of owning a personal car, the inability to take hours off of work to travel 35 or 45 or 1 hour to the nearest essential services hospital. Those prenatal visits are so important to the health of the unborn child and to the mother, and we are compromising their health. On UMass Memorial's website, it claims UMass Memorial Health is the health and wellness partner of the people of Central Massachusetts. Through pain and pandemics, our commitment to our communities never wanes. Their actions proved otherwise. I don't see a partnership with this community, and I am asking you to please protect the residents of this community from the delivery desert that is spreading across the Commonwealth. Thank you.
Thank you. Next is Representative Megan Kilcoin.
Thank you. And I'll keep my remarks brief because there's far more important voices than mine that need to be heard tonight. And my colleagues in the delegation, I think, spoke so eloquently about the impacts this will have on the community. For those that don't know me, my name is Meg Kilcoin. I'm state representative for the 12th Worcester District. That includes 6 communities sandwiched right between Worcester and Leominster and Fitchburg. I think it's important, as we are here tonight, to think about this in a bit of a wider context. You know, here in Massachusetts, we like to talk a lot about the fact that the Commonwealth is a leader on women's health issues, that as we see states across the country dismantle protections for women's health care, access to women's health care, we like to call ourselves leaders in this space. And in fact, I myself, a year ago, after Roe v. Wade was overturned by the Supreme Court, I stood before a group of high school girls. Some were 15, 16, 17 years old, who were crying, visibly traumatized by what they had seen in the news, and said they never wanted to have children because they were afraid of dying, that they were afraid that the government wouldn't protect them. And I looked them in the eye and I told them to not worry, that we in Massachusetts had their back. But what I didn't know then is that we'd be here just over a year later, begging the Department of Public Health, pleading with them to understand the impacts that this will have on our community, on women's access to health. My family has lived in this area for generations. My parents moved from Clinton to Sterling in the 1980s, and a year later, my mother was pregnant with me, her first child. This was a little over 36 years ago. My mother had the choice between choosing to give birth in Worcester or Leominster. I think all of us, my colleagues and I behind me, all of us get into this work because we believe that the areas that we live in, our communities, are the best places to live and work and raise a family, and everything we do is to further that mission. But what I say to you tonight is that we are not doing our jobs, all of us collectively, when almost 36 years later, when I myself, a woman who is in her mid-30s, will be looking to start a family, I will have fewer choices than my mother did almost 40 years ago. The impact this decision will have is it'll deprive women and families of choices. If we are truly committing ourselves to furthering access to health care, to ensuring our state remains a place where women can receive care without fear, then I hope that this decision does not come to pass. Thank you so much.
Thank you.
I'm going to submit written testimony from Congressman Jim McGovern. He was unable to be with us tonight because he had to be in D.C. I will just read the closing statement. I will do everything I can to be at the wind at the backs of the families and local and state officials who are trying to preserve a labor and delivery unit here in Leominster. Signed, Jim McGovern, Member of Congress.
Thank you. Thank you so much. Next, I'd like to call on Salvatore Perla and then Melissa Bible.
Good evening. Coming here today, this is my daughter. She's 11, born 11 years ago at Leominster Hospital, labor and delivery. She might not be here today due to she was born by emergency cesarean if it wasn't for Leominster labor and delivery. Going 30 minutes out of our way to find the care that we would needed, again, between my wife, daughter, is unacceptable. They keep saying the emergency department is going to be equipped, they're going to have this. They don't see this stuff every day. They don't have maybe the experience every day as we did with the labor and delivery. As a school committee member, seeing multiple students throughout the community coming from the Leominster Hospital, it is needed for the area. There has to be an option to keep it open. There should be no reason why it should be closing. Staffing, you hear all these different things. There's solutions to all of that. Every second counts when it's coming to delivering a child, and going a half hour or whatever the case might be should not be an option. It is needed for the region, and again, a solution should be found. Thank you.
Thank you.
Hello.
Melissa Bible.
My name is Melissa Bible, and I'm a member of the Leominster School Committee. However, tonight I also speak to you as a daughter, human service worker, wife, mother, and doula. And I encourage you to keep the Leominster Maternity Center open and not reduce access to reproductive services in our area. Tonight is not my first night speaking to you. I spoke at multiple meetings in 2018 about the shutter of the pediatric and cardiology departments. As a parent in this community, I ask you to keep two things in mind this evening: community and a consistent, predictable pattern of decisions that negatively impact our community. As a daughter, I can tell you that my brothers and I were born at Leominster Hospital. Both of my parents worked there, my father for over 46 years. I've seen the multiple renovations and expansions of the physical Leominster Hospital building. I can still remember the old wooden door that provided access to maternity from the maternity waiting room years ago. I can also recall when the decision was made to close Burbank, how we as a community repeatedly stated the impact this would cause and were ignored. I recall the impact that this decision had on my father, as he was able to keep his job and felt fortunate, but also lost coworkers and had increased work hours. Even today, this decision has impacted our communities and the ones surrounding, as access to emergency and reproductive care is reduced. This was a predicted result of the closure of Burbank Hospital. As a wife and mother, I can speak firsthand to the decisions that closing pediatrics has had to my family. I've spent countless hours in the Leominster emergency waiting room, waiting for care, or in the ER itself with my children, with prisoners in the adjoining room, or surrounded by patients waiting for mental health services. All things we were told would not happen when pediatrics and the mental health facilities were closed. We've had to be transported multiple times to Worcester by ambulance at additional cost, unnecessarily, additional stressors on families at a time when they're already concerned. And we are amongst the fortunate, a two-parent family with access to transportation. This is certainly not the ability of all in our community. We also predicted several things 5 years ago, that the maternity ward would be next, that by closing pediatrics, we were also reducing the amount of skilled pediatric nurses that could float from maternity, that in addition to putting families at risk, we were jeopardizing staffing. Again, we are at another predictable pattern of impact by UMass. I've been a volunteer doula at another community hospital. For years, many in our community have advocated for services to be expanded at Leominster. When I was due to have my youngest, I considered delivering him at the hospital I volunteered at and knew intimately. However, it was access to my local community, the staff, my OB, and knowing how close my family would be that what made me push to have my child at Leominster. It is my understanding that the closure of maternity is not solely based on finances, but is also based on a failure to be able to keep staff. UMass needs to think about why it is that we are here today. What decisions has it made over the years since it took over? How has it treated staff? How has it treated our community? How it has made decisions that valued profit over safety for all that it treats. How has the Leominster Hospital been valued when we can't be included in the name? My youngest son would have been born in Leominster one way or another. In many ways, I was fortunate. A 46-minute labor after spontaneous rupture in the middle of the night, 8 contractions of total active labor. If Leominster maternity was closed, we never would have made it to any of the 30-minute hospitals in the middle of the night. He certainly would have been born in a neighboring community of 190 or Route 2. And if anyone knows my husband, they would have known the hysteria that would have pursued. Due to the precipitous labor, my son inhaled additional fluids from the rapid delivery. Interventions were immediately necessary. He was put on supplemental oxygen, fluids, and antibiotics for 48 hours. Having a local community hospital nearby has been life-saving for many women and babies that will be jeopardized if maternity is closed. There are steps and actions that UMass can take to keep maternity open and viable. UMass has to want to keep maternity open. I ask you to predict what happens if maternity is closed. You don't have to have a crystal ball. Just think of the next predictive steps or consequences. And this is my prediction. If you close maternity, you will lose your OBGYNs as you have already lost your midwives. And with that comes a new sense of loss for women of all stages of life as we lose access to all types of reproductive care, from birth control to annual preventative screenings. And this will happen much sooner than 5 years. Tonight, I beg of you, DPH, as a wife and a mother, do not put our community and families at risk. Do not allow yourselves to be a part of a predictive pattern of bad decisions. Thank you.
Thank you. Next, we have Bill Brady and Greg Thomas. Okay, sorry, I heard there was a conflicting meeting going on at the same time as this. We're trying to stay in order. So I'm just going to call names. All right.
Hi, everyone. I'll be quick. My name is Greg Thomas. I'm on the Leominster School Committee. I'm here. I have two daughters, 10 and 7, who were both born in Leominster Hospital. I'm somebody who's big on data and analysis, and I probably went very deep into this one. All the data out there, all the Center for Health and Information Analysis, you know, it shows that we're a thriving community hospital, similar to other hospitals in the same cohort. We're actually doing better than a lot of the community hospitals. The data doesn't make sense. All the profit margins, all the ratios, all the things that you look at from a financial standpoint that point to a hospital that's failing is not there. Makes me wonder why Haywood is able to continue to do this and we're not. It doesn't make sense. It doesn't make sense at all. So thank you. I'll let everybody have a chance to speak. Thanks, bye.
Is Claire Freda or Bernie Schultz with us? Thank you.
Good evening. My name is Claire Freda, Leominster City Councilor at Large. And yes, it's unfortunate that this... It's unfortunate that this hearing took place the night of a Leominster City Council meeting. Some of us chose to be here. Some others chose to go to the meeting. So again, it's unfortunate that schedules aren't looked at a little closer because this is an important decision for our community. I have been on the City Council for 30 years, and I was here through the whole closure of Burbank Hospital. I was here through the process of, did we want our local hospital to go with a nonprofit or a profit hospital? It was a major effect on our community. Nurses were affected. There were both sides of nurses. There were disagreements. There was the hospital closure of Burbank. It was a horrible time. We got through it, not easily, but we got through it. We're an environmental justice community. We're a gateway community. Both of those are defined by the population that we have. And that population should be of the utmost importance to DPH and to the hospital and to the community. The hospital should have been a better community partner. It always was in the past. Maybe things didn't work out the way we all wanted them, didn't work out the way the hospital wanted them, but at least we had information. There weren't closures the day before Memorial Day where nobody had a chance to really react or have a discussion. Our city council wasn't even notified that this was going to happen. We were hearing it from nurses, from constituents, from people in the community that were hearing that the hospital maternity ward was closing. That's not the way to do business if you're a community partner. DPH's mission statement talks about keeping people healthy and communities strong. We promise the health and well-being of all residents by ensuring access to high-quality public health and health care services, focusing on prevention and wellness and health equity for all. And your own report that came out July 12th kind of says what everybody spoke of. Senator Cronin spoke eloquently about some of the issues. Is there something that our community could have done? We were here when I was here for the closing of pediatrics. I was here for the 2 major renovations of the hospital, when the hospital needed city council approval and help to expand that hospital so that our services could be expanded to protect our community. We were there. We had constant meetings. We had a lot of communication when they needed us. So I think there's a lot that was lacking in this time around, whether it was the employment of more local people that were working in that hospital that had a vested interest in making sure they came to the council, went to the mayor, talked to the representatives, talked to the legislators, and had more of a real care about what happened in this community. We're supposed to be community partners. That didn't work this time, and it's a real disappointment. Maybe this can be turned around. Maybe the help that the legislators are offering, if there's at least a discussion, which there hasn't been, some proof, some data. As a city council, I don't know, maybe some of my colleagues do, but I don't know what the real bottom line is. What drove this decision, how it got to this point, and how it was determined so quickly. So we're asking you, as an overseer and as an advisor, to look at this closely and make a decision that's in the best interest of a lot of people that need it. Thank you.
Thank you. Bernie Schultz, I assume, is not here. Susan Shalafu-Zafnik. Brandon Robbins would be next after.
Hi. Good evening, everybody. My name is Susan Shalafu-Zephyr. I'm a city councilor at large here in Leominster. I represent everybody throughout the city. And I've lived here my whole life. Council Freda told the history of the closure of Burbank, consolidation of services. And I have also participated and lived through, the closure of inpatient pediatric beds, the psych beds at Burbank, the cardio and pulmonary outpatient rehab facilities, services, all of those things. So as other people have said before me, and I won't belabor this, I think you have to really think about what is being said, what's being put to paper, and actually compare that against what the history and the actions have been. I know I'll make it brief, but I do want to address a couple of things. In UMass Memorial Health statement, they indicate that despite significant resources invested over the last 5 years in our sincere efforts to maintain the unit, when DPH does their analysis of this and they look at this case, and I hope that they do an in-depth analysis and get the specific information on what investments were made in the maternity unit. Okay? I think that's really important, and I think a point that Representative Slotnick made about the market here. Fitchburg and Leominster, both gateway cities. We also are surrounded by numerous towns that use Leominster Hospital, would use the birthing center. And if an organization that provides maternity services, which is one of the most basic fundamental healthcare services that a community hospital needs to provide, if they can't make it happen and work in this area, in this market, something is really wrong. There is I've heard numerous times that, staffing has been an issue. Again, referring to the UMass statement, this was based on a clinical decision based on our persistent struggles to appropriately staff the unit. I worked in nonprofit businesses my whole life. If I went to my boss or my board and I said, I can't deliver on something that is so crucial to our mission as staffing, I would have been told to find a new job. That's the way business works. And, DPH, the report that just came out in July, an assessment of severe maternal morbidity, as DPH knows all too well, morbidity rates among people of color are just skyrocketing. They're just going through the roof. And in conclusion, in this report, there are some related initiatives in order to address that, and I'll just read one of them briefly. And this is related initiatives. The Massachusetts Department of Public Health is committed to ending health inequities. Innovative efforts at DPH to address SMM, severe maternal morbidity, are currently underway, and it lists a few bullets. The last button says, DPH is addressing critical gaps in direct clinical care by exploring the use of CDC's level of care to ensure that birthing people are cared for at hospitals with resources and personnel to manage their unique needs and by implementing innovative health interventions. I would argue that moving forward to address this very serious issue, these kinds of healthcare innovations are really very important. I would argue that let's not make the problem worse by actually closing a facility, a service that's being provided. That will only add, it will just compound the problem. It's unthinkable to me that this is even a serious thing that we're discussing, to eliminate services, maternal services at Leominster Hospital. It's crazy. So, you know, again, when DPH does their analysis, I think it's very, very important for you to really prove, for UMass Memorial to prove the claims that they've made. You know, their priority is, you know, addressing health inequities. They've made investments in the maternity unit and other places in the hospital. Prove it. I'd like to know what those are. And I hope it's very important when DPH does their analysis that they get that information. Maybe they can share it with the rest of us. Thank you.
Thank you.
Hi, good evening. My name is Brandon Robbins, and I am the Vice Chair of the Leominster School Committee, Executive Director of a human service organization supporting low-income guests with basic needs, and most importantly, a member of the Leominster and North Central Mass community working to make our region the strongest it can be. I want to start by thanking you for coming out today and listening to members of the North Central Mass community about the impact of UMass Memorial Health Alliance Clinton Hospital's detrimental decision to close the birthing center at the Leominster campus. For decades, expecting families have been able to count on the steadfast and committed service of the Leominster labor and delivery doctors, nurses, and staff to ensure the safe delivery of their newborn. Today, this is now unfortunately in jeopardy. That is why I'm not only pleading with each of you that DPH deem this service essential, but additionally that the leadership at UMass Memorial will reconsider this decision and put expecting families first in their decision-making process. As those who have spoken before me have said, there are many reasons why I believe this decision is poor for our region. From the transportation struggles of families all the way to the new staffing challenges, safety challenges this closure will present families needing to travel more than 20 minutes for maternity care. All real issues that expectant families will now have to grapple with if this closure is allowed to happen. My partner is a labor and delivery nurse at a community hospital in Western Mass, and she experiences firsthand how quickly a low-risk delivery can become an emergency. Specially trained nurses and providers know how to intervene for good outcomes, but those who are not experienced in these sensitive interventions will put mom and baby at jeopardy. This closure means the happiest days of a family's life could easily become the most avoidable tragedy, and that is unacceptable. From a personal standpoint, as a 27-year-old who always wanted to raise a family right here in Leominster and has always thought his kids would be born in Leominster, where I was, it is heartbreaking to have that option taken away from my partner and I, and as I feel an ER and a birthing center seem to be the bare minimum that a hospital should have to offer when it calls itself a community hospital. In closing, I'll leave you with this. When challenges arise at a food pantry, like food shortages across the country that we saw during the COVID-19 pandemic, they can't just shut their doors. They look for creative solutions to serve the thousands of guests who rely on their services. Why is UMass Memorial allowed to shut their doors when challenges arise with the services that thousands of people in this region rely on?
Thank you. Next is Aaron Packard, and followed by Michael Ray Jeffries.
Thank you for the opportunity to speak here tonight. My name is Aaron Packard. I am the state committee man for the Worcester Middlesex District. We are steeped in a rich history of family in this community and this district. No matter what race, color, creed, income level, what have you, we all strive to have a wonderful root system here in this area. Now, what is happening here, closing this maternity ward, denying the women their care, those babies their care, is a critical mistake by UMass Corporation. Those women and children on the low income scale that do not have transportation, immediate transportation, just simply can't hop on the intermodal bus to go to Gardner to deliver. Because when that baby comes, it's coming, whether you're in transit or not. That mother needs to have her safety net. My daughter, my youngest daughter, was born here in Leominster. When my wife and I planned to have our family, we chose to stay here in Leominster. We got a tour of the maternity delivery labor facility that was in Leominster Hospital, and we fell in love with it. It wasn't just the facility, it was the nurses staff. Number one, nurse staff. Followed by their expertise in critical care and the doctors who guided them. My wife needed to have a cesarean because of her small stature. We had a very large daughter. Well, during the prepping of this, a medical anomaly occurred and she had to be put out. Had we not been in Leominster's maternity ward, who knows what would happen? And I don't want to speculate because she's a beautiful 16-year-old girl that lives here in Leominster now. And I would, for one, would love her to grow and start her own family in this district, in this community, where we can go right down the road, 10 minutes, quick, get her to the labor. If you're living in Fitchburg, you have to wait and decide where you're going to go next. Out to Haywood at Gardner? How are you going to get there? Especially if you don't have transportation. Especially if you are in a crisis moment where the mother needs immediate assistance. Well, it's going to be 10, 15 minutes for the ambulance just to arrive, just to get there. You're taking away a critical need of families, no matter what their income level is, and it needs to stop now. You say it's not about financials? It is. It certainly is. So if any of you bean counters would like to drop your salary down to keep this labor and delivery open, by all means, do it.
Thank you. Michael Ray Jeffries.
Good evening. I'm Michael Ray Jeffries, chairman of the Lunenburg Select Board. Lunenburg is an idyllic town in north central Massachusetts. We pride ourselves on being a community, on being a farming community. Though over the last 20 years, we have also become a bedroom community where most of our residents travel elsewhere for work and then return home to a rural atmosphere. Our median household income is a little over $101,000 a year. 40% of my neighbors and fellow residents have a bachelor's degree or higher, and nearly 85% of our high school graduates go to college. 79% of all homes in Lunenburg are single-family homes. Lunenburg is beautiful. Crime is minimal, we have great roads, our snow removal is exceptional, our school system is phenomenal. Our Boys and Girls Club, food pantry, and after-school programs happen in municipal buildings. And Lunenburg commits 52% of our tax revenue to support our local school system. We want Lunenburg to be an attractive place to live. It is. And it is especially appealing to families. 15% of the residents in Lunenburg are women between 18 and 44 years old who are presumed to be in their childbearing years. They live with partners in about 1/3 of our homes. This closure will decimate the family-oriented fabric of my community. Let me be specific. Lunenburg has 2 ambulances, but due to an accident, we've only had 1 for the majority of the year. So what happens then when we only have 1 ambulance available and it's transporting a cardiac patient and a call comes in for a premature labor? With community support agreements, it will be 10 to 15 minutes before help arrives at a home. Without traffic, the distance to Leominster Hospital from the northernmost part of Lunenburg is 14 minutes. Haywood Hospital is 38 minutes away. Emerson Hospital is 37 minutes away. The UMass hospitals are 39 minutes away. The Hippocratic Oath, which has been a foundation of medicine for nearly 2,400 years, It notes primum non nocere, meaning first, do no harm. So if you could imagine a woman pregnant and bleeding, going into labor many months early, help me understand how this proposal causes no harm. Tripling the commuting distance to receive basic health care, it causes harm, undeniable harm, clear and apparent harm. Massachusetts boasts the best healthcare system in the country. We boast having the best schools in the nation. And just down the street in Devens, we have the North American headquarters for Bristol Myers Squibb, a pharmaceutical company that realizes $45 billion a year in revenue. The creation of a healthcare desert for women and families in north central Massachusetts will make our entire region unappealing. It will affect businesses' ability to attract and retain skilled professionals. It will negatively affect home values, and most importantly and shamefully, it will significantly decrease positive healthcare outcomes for pregnant women and their unborn. On behalf of the Lunenburg Select Board and all residents I have sworn to represent, we demand for this proposal to be stopped. We should not, with eyes wide open, walk into this proposed closure knowing that more babies will die, more women will die. And when babies and women die, marital and family relationships and needed mental health services will be further strained. We are all in the people business, and we all depend on Leominster Hospital doing its part to support us in our times of greatest need. Let's identify how we can all be part of a community solution, but primum non nocere, first, do no harm.
Thank you. We're still taking local officials. Next, Mayor Dean Mazzarella.
Found him in the hallway. Mayor Dean and Valley. Go first. You got me on that list?
Come on. All right, DPH, thank you so much.
He thought he was signing up for the buffet.
By the way, Mr. Jeffries, I'm so happy that Lunenburg has nice roads. That's really great to hear. Thank you. Yeah, thank you again. Yeah. You know, first I want to thank DPH for coming out to the Leominster, Fitchburg area, the Twin Cities, and providing us with an opportunity to hear some of the concerns that certainly the people have. What I'm going to focus on is a communique to the state auditor, Diana DiZoglio, from myself and Mayor Mazzarella. The disproportionate effect on families is clear. I think you've heard that over and over again. Families, some with any means of reliable transportation, would be forced to commute to Gardner or Worcester when faced with any number of emergency medical situations and requiring specialized care. UMass Memorial cites workforce shortages and financial considerations as central to their decision. I don't doubt that. Let me just report to you right now the amounts of money that have been provided to community hospitals over the last several years. Leominster Hospital and its parent company, UMass Memorial Healthcare, and affiliates have benefited from over $85 million in state assistance in the past 2 years. This funding comes from ARPA grants and safety net hospital funding pursuant to the Commonwealth Section 115 extension. This $85 million is separate from additional statewide commitments of $260 million in ARPA grants to hospitals impacted by COVID-19 and $500 million for premium pay bonuses to essential workers throughout the pandemic. So part of the reason why Mayor Mazzarella and I have reached out to the auditor is we would like a clear understanding of where that money was spent. This is a community hospital. I have many friends there in the administration and otherwise. My family members, a lot of them work there as nurses and attendants. So it's truly a community hospital. I fear that the chipping away at that hospital will result in a satellite facility. That's it. This is the North County. We can't afford a satellite facility. Every hospital system that receives these funds is obligated to be a good steward of taxpayer dollars and spend each cent towards a proper and efficient end. This is also what we're imploring the auditor to take a look at. We request this audit for the sake of transparency, accountability, and to try and answer the burning question in the minds of our constituents. How on earth could this happen, considering just how much was given to UMass Memorial? Thank you.
Thank you. Mayor Mazzarella.
Thank you, and welcome to our city, and it's going to be a long night for you. So each one of us starts off by saying we're going to limit our comments, and then we don't. So I'm going to tell you right up front, I'm not going to limit my comments. My name is Dean Mazzarella. I've been mayor for 31 years, every day. I have fun, I enjoy my job, and I meet the greatest people. And let me just tell you who we are, because I'm not sure what cities you're from or what areas you're from, but we are products of, we are workers, parents that have been workers of factories and the paper industry, the plastics industry. We are hard workers, the construction business. We might not be rich, but we are hard workers, living the American dream. And we're not dumb at all. And that's why we're here tonight, because this is important to all of us, obviously. State representative said, and sometimes scrappy meets scrappy. I'm scrappy. I was around, and there are a few of us in here who originally, when the two hospitals needed to merge because, the healthcare industry was changing, we heard everything. We've heard it all. And the two hospitals were going to close, and then the emergency room in Fitchburg. And the analogy was, it's less important about where the emergency room is, if you're in Ashby, Massachusetts, than getting help to you as soon as possible. Well, they went ahead and hired some paramedics and contracted out so they could get the paramedics to these people's houses instead of getting them to the emergency room. And it wasn't very long after we noticed there were no more paramedics. So everyone that went along with this merger is now looking for paramedics when somebody's having a heart attack or whatever the issue might be. They're in towns in Ashby, Fitchburg, Lunenburg, Leominster, and some of the rural parts. It's a long way, and there are no paramedics, none. We then had to make another decision locally, us in this room. There was a time when we needed to affiliate ourselves with a bigger hospital after the merger. And the reason for that was, and at the time, UMass said to us, and we have all the documentation to back it up, is you're losing too many of your services. You get involved with us, we're going to bring back those services and even more, and even more. And the term they used, I guess this at the time is my worst word of all, but it's called leakage. They were losing, see, she's smiling, she knows what I mean. They were losing business to other hospitals. They were going to bring it back and expand here. It never happened. Item by item, project by project, we lost services. Now, can you imagine? We told people in those rural areas, don't worry about it, we'll get you help. Forget the emergency room, we'll get you paramedics. And now we're telling them, don't worry about it. If you live in Ashby or Lunenburg or Townsend or Fitchburg or up, rural Leominster, don't worry about it. It's only 20 minutes to get to one of these hospitals. It's 20 minutes to get from Leominster to Fitchburg, let alone to get to UMass. So we've heard it all. And the biggest kicker is that we all know, and of course, we want to save our hospital. That's only natural. That's why we're here tonight. But we don't believe that this needs to be closed. I think we lost market share by a bunch of people who don't live here. And it's not that babies aren't being born here. It's somebody dropped the ball somewhere along the way, and we lost our market share to places like Emerson and UMass. And the biggest kicker is, I almost fell off my chair when I got the call that they were closing it, like everybody did. And then I was told, but don't worry about it, you'll be able to go to Gardner. And they have a good hospital with great people. But I couldn't believe what I was hearing. Go to Gardner, that's back the other way. And if you have a troubled pregnancy, that's even further to get you to UMass. None of this makes any sense. I asked a question at the meeting that we had with the officials at UMass, and they're nice people. Listen, they're nice people. And I asked, if we were to reboot this thing and not take one new delivery at Leominster Hospital for a year, how much do you need to turn this thing around? 5 million, 6 million, 3 million? What is the amount? Because as elected officials, we're willing to do whatever it takes, literally, to get that money raised and to keep our maternity ward. That's how important it is to us. And what I heard was, even if we had the money, we wouldn't put it into the maternity ward. So I want to just close with one thing. Today I opened one of my emails, and there's hundreds, just like everybody else gets. And there's an email, and it said that a organization was coming to the city, and they were going to open OBGYN offices here in the city of Leominster. And it was from the very people they lost market share to. So don't tell me that there's not a need here in the city of Leominster, Fitchburg, this whole area. No one can tell me and convince me. Today that email came through. Going across the street, one of the office buildings over there. I mean, that's insult to injury. Nice people. As Councilor Zephyr said, in our industry, listen, every industry's changed. Is anybody here working in an industry that hasn't changed? You can't always use the excuse that, well, healthcare is changing all the time. damn, I run a city of 45,000 people. Every day it changes. That's the reality of the world. So we need to stop using that as an excuse because every industry changes. We've got to raise some money. We've got to get them to go along with it. We need to raise some money, hit the reboot button, and get that maternity ward up and running again. And if we have to bring in other people to run it and subcontract or get an overseer to do it, then it's time. Let's start today. Please keep our very valuable. We're not rich people. We're not. It's always the poor people that get hit. Every single time, it's them. Every time. I don't care what it is. Please give us 6 months, a year. Keep this maternity ward open. Make them work with us, and we'll show you what we can do. We'll be back here for a celebration. Thank you.
Thank you, Mayor. Eileen Griffin is next, and then Ronnie Houle.
Hi, I'm Eileen Griffin. I am a Ward 5 school committee member, and the hospital is actually in my ward. But I'm also a professional social worker who works extensively in the North Central area. I myself gave birth to my daughter at Leominster Hospital. My daughter has given birth to her 2 children at Leominster Hospital. A shout out to the wonderful care, compassion, and skill from all the nursing staff that made both of those situations wonderful. But what I see firsthand professionally is we work with a lot of disenfranchised, vulnerable population here in our communities. People who do not have financial stability, they don't have the resources, they don't have transportation. We are going to see an uptick of home and roadside deliveries, which will only put not only the mother, but the unborn child at risk. For those children, babies who are born that may be premature, they may be born substance exposed or medically complicated, if they are located in Worcester, our families are going to have a difficult time once they're discharged from the hospital being able to visit those infants and establish that critical bond that needs to happen from day one. They're not going to be able to afford, I think it's $22 one way for a taxi. They're not going to be able to afford to get there or to visit their baby. We see that this is going to greatly impact the delivery of services to the people who are poverty-ridden, of color, who don't speak English necessarily. We are going to see an exodus of OBGYN providers. Already we have a large population who don't necessarily avail themselves of prenatal treatment. This is going to make that more difficult for those families that are on the fringe to receive prenatal care, which is only going to exacerbate and potentially put children, babies at risk because they won't have gotten that care from day one, because those services are going to be moving out of our area if our birthing center is moving out of our area. So please, you've heard a lot more eloquently people than me, but we do need to keep this maternity ward, to keep our women, mothers, babies safe, to have quality care so that they can thrive. And this community and our surrounding communities are rich in generations of people choosing to live here and have families here. So we hope that the Department of Public Health makes a good decision to keep our maternity ward at the Leominster campus. Thank you.
Thank you. Next is Ronnie Houle, followed by Peter Angelini.
Good evening. My name is Ronnie Houle. I'm an RN, I'm a veteran, and I also am on the school committee. I represent Ward 2A, B, and C. I am here speaking for my constituents. They're going to be hampered by this decision. I find that this decision is a political act of obscenity, couched in a massive form of medical malpractice. It's as simple as that. Where in the heck have these people thought of regarding health care for people, reproductive health rights? Where the heck is it? They're not addressing that at all. I'm embarrassed. I really am embarrassed as a nurse and as a veteran. I didn't spend 2 years in the military to have some wannabe military-industrial complex people dictate to us how to provide medical care. Do I sound angry? Heck yeah. Do my constituent out there in Ward 2A, B, and C, don't you think they're angry? They're being marginalized? I don't represent one person or two persons, I represent them all. I'm here to speak for them. And finally, do you know whose big fault this is? You guys, the DPH. Because you are a perfect example of a toothless paper tiger. And I should be careful about saying toothless because there are many people out there who are toothless and it's not their fault. But it's your fault. You brought this on upon us. You brought this because you let them carry on. There's no bite in your mannerisms. No bite at all. It's an embarrassment. And everyone's talking about maternity. I would push back and say, bring back pediatrics. What the heck is going on? Who is it? Who's running this show? What an embarrassment. You hear the crickets and laughter when they hear about this. And we're just standing here and we're complaining as if that's going to do any good. It's an embarrassment. If I was part of DPH or part of this group right here, and I had to look myself in the mirror in the morning, I'd vomit. I'm embarrassed. I'm embarrassed to say that I belong to the medical establishment. And we were always told, yes, the guy was saying, do no harm. Ha! That's a joke. How many children are we going to see die? How many women are we going to see dying? Whose fault is it going to be? Who's going to pay? See that? Dead silence. That's exactly what's happening. Dead silence. I'm not happy.
Thank you. Is Peter Angelini here or at City Council? I'm sorry. Then could you kindly go in his place?
Good evening. My name is Bill Brady. I'm the Ward 1 City Councilor for Leominster, and I probably made some enemies on the City Council tonight because I had to be here. I have a very long history with Leominster Hospital. My mother taught nursing there when they had a nursing school from 1969 to 1989 when they closed it. I basically grew up on the hospital campus. It's part of the fabric of our lives here in Leominster. I could probably still tell you the lady who ran maternity for a number of years was Mary Foster. She was my den mother when I was a Cub Scout. Okay, this is the type of history we have here in this location. I don't believe the administration of UMass Clinton, I guess we can't call it Leominster Hospital anymore, doesn't have the beliefs nor the best interest of the citizens in Leominster that I represent at heart. I would plead with you to please intervene on our behalf and make the decision reversed. Thank you.
Thank you. Next is Anthony Zarella, who may be at the City Council meeting. Thank you.
Good evening.
I'm Anthony Zarella. I'm the council president for Fitchburg. And I'm going to start off by saying a few things that anyone who was here a few years ago for the last round of closures might find a little repetitive. And that's largely because it's the same situation all over again. I would encourage you, members of the DPH, to look around the room. Not at the number of people. I'm sure many people have already told you to do that. I want you to look around the room and look at yourselves, look at me, look at the officials here, look at the UMass people here. Look at, the nice blouses, the suits, the ties. For someone like me, it's a minor inconvenience to go to Worcester or Concord or Gardner if my wife goes into labor. For someone like me, I can do that. I have reliable transportation. I have a job that would allow me to leave in the middle of the day if I needed to bring her in. There are an awful lot of people that I represent in Fitchburg who have never owned a suit or a silk blouse or anything of that nature, who have never owned a car. For them, the idea that Worcester or Concord or Gardner is, to use the phrase that UMass used last time, within the service area. It's ludicrous. What are they supposed to do? Ride their bikes to Worcester? That's how they get to work. So I would urge DPH and I would urge UMass to get out of the mindset that you live in every day, where a 20-minute drive is no big deal. Because you're right, for you it's not, for me it's not. There are an awful lot of people for whom it is. I was born in Leominster Hospital. My brother was born in Leominster Hospital. And there are people in Fitchburg and Leominster and the surrounding towns who have had literally generations born in Leominster Hospital. In fact, in some cases, I know of families whose children were delivered by the same doctor who delivered them. That's what you get with a community hospital. And that's what we need here in this community. North Central, if this labor and delivery center closes, North Central Massachusetts, not just Fitchburg, not just Leominster, the entire region will have exactly 4 options to get to go to deliver their children. There's Haywood Hospital in Gardner, which I'm told is a very good hospital, but I'm also told that they are struggling with their current load of patients. So let's throw a drowning man an anchor and send them all the patients from Leominster Hospital. There's Worcester and Concord, which, again, under ideal circumstances for someone with reliable transportation, that's 20, 30, 40 minutes, depending on time of day. Under non-ideal circumstances, think about the rains we just recently had. Can you get from here to Worcester in that kind of rain in 30 minutes? You're going to be on the road an hour, hour and a half. And the 4th option is the emergency room. And I don't think I need to tell anyone here that that's a horrible option, not only because the people who work there, I know plenty of people who work in the emergency room, and they are excellent healthcare providers. They are diligent, hardworking. What they aren't is specially trained in labor and delivery. Moreover, what happens when 2 ambulances arrive at the emergency room, one carrying an expectant mother who's in labor and one carrying Uncle Joe having a heart attack? Well, from what I've been told, talking to healthcare professionals, the triage nurse would prioritize the mother and child, which is only right, but what happens to Uncle Joe? And it's clear from the way this has gone down that this is not a decision that's being made by anyone who has any familiarity with this community. It's a decision that's being made by someone sitting in front of a computer with a spreadsheet and moving numbers around. This is my daughter, Miriam Grace Zarella. She's just under 3 years old. She is not a number. She's a person. And I don't really care if the numbers work better if everyone is diverted to Worcester or Concord or Gardner. There are people in this community who need service not in half an hour. They need service in 10 minutes, 15 minutes. We keep being told that UMass Memorial is a community healthcare provider. But what we're seeing here is that they have no concern for the community, no focus on the health of the residents, and ultimately, no care. This cannot be allowed to happen. And I understand that the options DPH has for any mandate or coercive measure are very limited. But whether it's DPH, whether it's UMass administrators, someone has to start thinking past the numbers and thinking about the people. We want more generations raised in this community, born in this community. We don't want more people buried in this community. That's right. Thank you.
We will now begin taking comments from the public. We ask that each person who wishes to speak do so only once, clearly state and spell your first and last name, and that you please limit your comments to 3 minutes or less, so that there will be time for all who wish to speak to do so. We have extended the period of time for public comment, seeing as the hour is moving on and the hotel will not be available much past 10 o'clock tonight. So please know that comments can be written to us until 12 noon tomorrow. If you need the information, it is, again, HFL license action at mass.gov. There are little handouts at the front sign-in desk should you wish to submit comments to us. Or you can fax to 617-753-8089. Again, we will accept written comments until noon tomorrow. This is not, I'm so sorry, this is not a question and answer period. Is it about the written comment?
No, because I was written next to my naming for citizen.
Okay, we haven't started the public comments yet, so we're going in order.
All right.
Thank you.
Thank you.
Okay, our first speaker is Katie Murphy followed by Carrie Noseworthy.
Good evening. My name is Katie Murphy. I'm president of the Massachusetts Nurses Association, which represents 25,000 nurses working in more than 85 healthcare facilities from Martha's Vineyard to the Berkshires. Unfortunately, the nurses we represent are too well acquainted with this process, as we have attended more than 30 of these hearings dealing with the hospital industry's misguided decisions to boost their profits by cutting essential services to the communities they serve. Most often, those communities are strategically disenfranchised communities or serving people of color. And this is now the 10th such hearing in the last decade dealing with the closure of a maternity unit. In all of these cases, after hearings like this, that the department deemed that all of these services were essential to preserving communities' access to the care they provided. Given the turnout here tonight and the mountain of evidence provided, you will have no choice but to do this for the birthing center. You will be supported in that decision by your own recently released alarming report about the rising tide of maternal complications and deaths due to the state's failure to provide adequate access to appropriate maternal child health services like this service. A report that demonstrates the outsized negative impact on women of color, the very populations placed most at risk by the closure of the only unit serving these two gateway cities. But in all of these cases, your lack of authority is to stop any closure. UMass may very well choose to go ahead and close the service regardless of the evidence, regardless of the suffering it causes, regardless of the potential maternal child health deaths that may result, and in blatant disregard for the needs of the communities you have licensed them to serve. Like all those other cases, you will detail a number of avenues they are to take to compensate for the loss of this service. But you know, and we know, that there is no viable alternative to closing a service like this other than keeping it open. We also know that as in all these other closures, there will be no follow-up to ensure any accountability for meeting the requirements you impose. This needs to change, which is why we have proposed new legislation that would strengthen your hand in efforts to preserve these essential services. But we are here again tonight to raise our voice with all these other voices in the hope, however fleeting, that UMass Health and Eric Dixon, in the face of this outrage and this opposition, will see the moral and ethical failings of this decision, will change course and decide to preserve this service. In closing, I would like to quote our esteemed governor and avowed champion of women, who in the press release accompanying the recent DPH report said, "This report shows that it is essential that everyone has access to comprehensive, high quality, and inclusive maternal health care. We can and must do better for mothers, for kids, and for families, and our administration is committed to doing just that." I can tell you that here, we at the MNA, as members of the Community United to Save Our Birthing Center Coalition, regardless of what happens tonight, will not give up and will do whatever we can to convince our governor to honor her stated commitment to access to maternal health care by doing whatever we can to hold UMass Health and Eric Dixon accountable for protecting these communities by preserving this vital service.
Thank you.
Good evening. My name is Carrie Noseworthy. I live at 95 Smith Street in Leominster, just blocks away from the hospital. I know I'm taking away from my own time, but I do want to say that although I very much value and appreciate the words of all of our esteemed legislators, I don't think it's equitable to give them endless time and have individuals in the community be limited to 3 minutes. I'm here tonight as a mother of 3 children and as a community advocate. As a former Len Fellow, and that's Leadership, Education, and Neurodevelopmental Disabilities, through UMass and the Shriver Center, I fully realized the program's focus on parity and equitable access to health care, and it was deeply ingrained in my psyche. It helped reinforce and hone my advocacy efforts. It helped me to understand that we're not here to focus on equality, but equitable access. And I find it a little bit ironic that I'm here tonight. As a mother, I know firsthand that anything can change during pregnancy and childbirth, as was mentioned earlier, and that seconds and minutes can make the difference in outcomes, as they did when my middle child was born with the umbilical cord wrapped around his neck, and they had to use a vacuum to get him out, and a vacuum for my third child. As the oldest of 6 children, when my youngest brother was born 34 years ago at 1 pound and a few ounces, if my mother and he were not able to get the health care that they needed, they probably wouldn't be around today. Maternal health care in the United States has steadily been on the decline well before the pandemic, with a mortality rate, I think in 2020, of 23.8 deaths per 100,000 live births. If you're wondering how big of a deal that is, New Zealand's number is 1.7, and ours is 23.8. When you dig deeper to the equitable access and parity, though, Hispanic women had the sharpest increase in maternal mortality just since the pandemic. Black women have 3 times the maternal mortality rate than their white counterparts. Equitable access. Even prior to the pandemic, the numbers were trending in a very negative direction, so they're really not skewed. So we know that the seconds and minutes count. We know that Black women and other women of color are disproportionately impacted, and that's here and now. If we further remove access to labor and delivery units, we know what will happen. You don't have to be a statistician. You don't have to be a doctor or an obstetrician. Maternal health will take an even deeper dive, and we know who that's going to impact. It's going to impact Black women and women of color most of all. Who else will be impacted? I too am a veteran. Our first responders, and I just want to say that we all value our first responders very much. And to put them in a space where they don't have the equipment or the training, as they are not obstetricians, and then further traumatize them with a secondary trauma when things don't go well, I think is another thing that should be thought about, because I don't feel that it's responsible. Our numbers now are dire, and why would we pull the rug out from under the feet of these women, knowing that there would be an act to decrease access to care, decrease access to best chances someone has to the healthiest start they have in their life, as was mentioned earlier, instead of having to fight through early intervention and special education for the rest of their lives? It's irresponsible. Our rights as women nationally are being pulled away. Again, I'm a veteran. I did not fight for this, as Ronnie mentioned. Now is the time for Massachusetts to stand up and tell everyone that we will not contribute to healthcare deserts, that we will instead lead the way to healthcare parity. Please keep Leominster Labor and Delivery open, and let us choose to lead the way to parity and equitable access to healthcare. Thank you.
Thank you. Next is Lindsay Gravel, and after that, Tara Corey.
Good evening. My name is Lindsay Gravel. I've been a postpartum nurse in the birthing center at Leominster Hospital for 3 years now. And I believe the closure of this service would be severely detrimental to this community. We serve so much more than just the 2 gateway cities. We see patients from upwards of 10 other towns. And some of these women already were patients at UMass or St. Vincent or Haywood and Gardner, and they couldn't make it there to deliver their baby. So what are these women supposed to do if this unit closes? The next closest hospitals are already full of patients. We've had several situations recently in which these hospitals do not have room for transfers, including a 31-week delivery in which the mother arrived at Leominster too far along to be safely transferred. In fact, it is illegal to transfer an unstable patient. The baby was brought to the NICU in Worcester. However, they did not have a bed available for mom, so she had to stay 23 miles away from her tiny new miracle. UMass has declined several transfers due to no availability recently. We've even had several deliveries in our ER recently, one of which was a 24-week demise. This mother would have lost her baby in the back of a moving ambulance had they not stopped in Leominster. And both of these deliveries needed the assistance of 2 to 3 maternity nurses, an OB, and a PD hospitalist, all of whom will not be there come September 23rd if this unit closes. So I ask you, how are these hospitals going to take on our 500-plus mothers and babies if they can't even take on a few right now? And how will our ER staff... And how will our ER staff handle these situations when presently the neonatal resuscitation training is only optional? EMTs, paramedics, and ER nurses are not trained to handle obstetrical emergencies, and they're terrified, just like the rest of us. Babies will continue to be born in the ER with no privacy, with sick and dying people in the next rooms, in the back of moving ambulances, or simply on the side of the highway. This is unsafe, and the women of our community deserve more. They're claiming the reasons for this proposed closure are workforce shortages and a decline in births. 500 is not a small number. For the past year, they have ignored applicants for open positions in labor and delivery. We personally know several nurses who have applied and just never heard back. And yet, once the closure was announced, the hospital hired 12 traveler nurses to overfill these vacancies. We're continually told it's not about money, but that they can't find the staff. But they haven't been trying. There's been no marketing, no incentive to retain employees, no attempts to solve the problem. We have offered to cross-train our current employees to help the situation as well, but have received no response. If it's truly not about the money, then let's work together to correct this simple problem instead of closing such an important service and putting hundreds of lives at risk. Our focus needs to be the women and future children of this community because it just doesn't make sense. We're truly concerned and frightened for these women who can't travel farther, for the inevitable lives that will be lost if the unit closes. And these women and families rely on this community hospital. They'll be left with substandard care, and it's simply immoral to close this essential service. That 30 minutes is a matter of life and death. Thank you.
Thank you. Tara Corey.
My name is Tara Corey, T-A-R-A-C-O-R-E-Y, and I too am a nurse at Leominster Hospital. It is also where my husband and I were born, and it is where I chose to give birth to both of our children. The birthing center is quite literally where my life and my family began. I stand before you today to speak against the proposed closure of this unit. The CDC states that an essential public health service allows everyone to have fair and just opportunity at achieving optimal health and well-being. Leominster Hospital's birthing center serves families from Leominster, Fitchburg, and so many other towns in north central Mass. As a nurse who sees patients come into the hospital and deliver within minutes of arriving, patients come in via EMS or taxi because they do not have personal transportation, patients who come in because they were supposed to deliver in Worcester but don't feel that they can make it in time, and especially as a nurse who has seen how quickly a normal delivery after a low-risk pregnancy can turn bad, I cannot be convinced that closing this unit would allow for optimal health or well-being for approximately 600 mothers and babies a year. Since the proposed closure was announced, we have had so many families sharing their experiences with us. There have been numerous stories of quick and emergent deliveries that many feel would have resulted in death of the mother and or baby had Leominster's birthing center not been there. When my own daughter was born, she required immediate intervention. I was unable to hold her in my arms for 9 hours after delivery, which equate to the worst 9 hours of my life. But I watched those nurses tend to her and take care of her like she was their own, and I am thankful every day for Leominster Hospital's compassionate and skilled maternity nurses and providers for saving my miracle baby, along with so many others throughout the area. After all, small-town hospitals deliver small-town miracles. If you love someone who lives within the 30-mile radius of Leominster, or even drives through or by town on any given day, you should be concerned about this proposed closure. If the closure proceeds, lives will be lost across the board. The domino effect will begin on September 23rd, and it will last forevermore. As it is, ambulance availability for transportation is scarce, but now they will also end up being tied up for what could be hours at a time transporting these mothers to other hospitals and then having to make the return trip back into town. This leaves the public vulnerable to many adverse outcomes as there will be delays in ambulances responding to other medical emergencies throughout the region. And then there is the fact that mothers will be delivering in the emergency room. Wait times in the emergency room can already be extensive due to an increased patient census, more complex medical care, and staffing issues. Without an obstetrician, pediatrician, and skilled labor and delivery and nursery nurses, uncomplicated deliveries will require multiple staff members, let alone if there is an obstetrical emergency or neonatal resuscitation is required, or both at the same time, which take a minimum of at least 5 people for each. This will leave other populations of the community waiting longer in the emergency room for care, which is both dangerous and inhumane. Closing the birthing center is not as simple as redirecting patients to Worcester or other hospitals. It is quite clear that this proposal is being presented by a management team comprised of individuals who have never stepped foot on the birthing center to witness the populations we serve and the lives we save. Some with no medical backgrounds who quite simply cannot comprehend the complexity of labor and delivery or all the other medical emergencies and bad outcomes that this could cause. A team who does not care about this community because they do not live within it. Issues that they have orchestrated as onlookers should have been prevented or addressed before such a dramatic proposal was put forth. The proposed closure certainly would not allow for a fair and just opportunity at achieving optimal health and well-being for many people of all ages in many towns for many different reasons. Leominster Hospital's birthing center is an essential service for this community, and it's as simple as that. Please leave labor in Leominster. Thank you.
As a reminder, we ask that each person who wishes to speak do so only once. Clearly state and spell your first and last name, and please limit your comments to 3 minutes or less so that there will be time for all who wish to speak to do so. Again, if you prefer to submit written comments, you may do so by email through noon tomorrow at hfllicenseaction, all one word, @mass.gov, or by fax to 617-753-8089. Next is John DeCicco, and afterwards Sharon DeCicco.
John DeCicco, JOHN-DECICCO. Good evening, distinguished members of the committee, and welcome to Leominster to learn about this extremely important health care matter before you this evening. I am John DeCicco, a lifelong resident of Leominster, the Commonwealth of Massachusetts, and was born at Leominster Hospital. I'd like to lead off my comments and concerns with the mission statement of the UMass Memorial Healthcare System, taken from their website, as I believe that this statement should serve as your litmus test during your deliberations. UMass Memorial Health is the health and wellness partner of the people of Central Massachusetts. Through pain and pandemics, our commitment to communities never wanes. We use knowledge and innovation to create breakthrough medicine, to create jobs, to make life better for those we serve. We are leaders in the training of physicians and those who work in every facet of healthcare. We make outstanding care accessible for all, regardless of ability to pay. We stand for quality, compassion, dignity, and opportunity and fairness, and we are relentless in our pursuit of healing. At face value, I honestly believe that this mission statement is truly sincere and reflects the goals and objectives of every medical professional currently employed by the UMass Medical Care System. I believe that the UMass healthcare system was created to serve the needs of the citizens of our Commonwealth throughout the state. Unfortunately, somewhere over the past decade, this key component of the mission statement, healthcare for all, has been lost at a time when it's needed the most. Post-pandemic has proved to be challenging in all facets of life for everyone. Certainly the professionals of our healthcare system have had to deal with more than their fair share during this unprecedented crisis in their day-to-day work environment. The public is still reeling from this crippling pandemic and is now being asked to endure yet another cut to a vital component of healthcare and the very foundation of our society and quality of life. Eliminating the labor and delivery unit at the Leominster Hospital would be risking the lives of pregnant women, their babies, by subjecting them to unnecessary transportation to other hospitals for delivery, when minutes can be the difference between life and death. For the UMass medical professionals who are members of the Board of Trustees to suggest that a 30-plus minute ride to another hospital out of town is perfectly acceptable flies in the face of their mission statement that, quote, "We make outstanding care accessible to all." If any of them were being honest in their analysis of the time it takes to reach another hospital outside of Leominster area, they would have to admit that this time frame, given the current state of our roadways and daily traffic congestion, is not realistically achievable, even by ambulance. If this proposed closure becomes reality, these expectant mothers would not be able to receive the level of care they require in their time of need. The ambulance services in both of our cities are already stretched to the breaking point daily, even with the support of outside vendors that service our hospital. So to suggest that they would be able to pick up these additional patient caseloads for those in need of emergency transport is totally unrealistic, leaving the statement of accessible to all a failure of meeting their mission statement. Unfortunately, recently we have been seeing more and more stories about EMT firefighters and police officers delivering babies on the side of the road when expectant mothers can't make it to a hospital in time. This gives a false sense of security, as there could be more complications that the ambulance is not equipped to address in these critical care moments. Is this the new norm the Board of Trustees and the medical leadership of UMass is willing to embrace as accessibility to all? As a citizen of the Commonwealth, I would like to believe that the UMass healthcare system was created to serve all of us, regardless of what zip code we reside in. After all, it's our state's premier healthcare provider and is supported through our tax dollars. The UMass healthcare system is recognized as being a leader in medical research, education, and direct healthcare delivery in the Commonwealth. In a state that has a wealth of world-class medical research facilities and hospitals, UMass needs to be the leader. However, the current plans of the Board of Trustees to close the labor and delivery unit at Leominster Hospital does not emulate the work of leaders, but rather only works to set back health care in our two cities and surrounding communities back generations. The closing of the unit would not only pose an immediate threat to the safety and health of expectant mothers, but also leave behind a chilling effect on our area for generations to come, as no one is going to choose to reside in our communities, knowing there's no safe future for them to start their families here. I implore you to consider the long-term effects of this plan will have on the Commonwealth of all people of Massachusetts. For generations, our state has been the leader in health care. Do not be party to turning back that progress, and most importantly, turning your backs on the citizens of Central Massachusetts. Demand that UMass dutifully discharges their mission statement by continuing to deliver outstanding care for all by maintaining accessibility at Leominster Hospital. There is no city or town in the Commonwealth that should be subjected to becoming a desert for health care, especially beginning of life care. I'd like to present a personal analogy based on my past career work as a public school educator. When being part of a team of educators formulating a mission statement for my school, we would always be tasked with not only creating a mission statement that would be all-encompassing based on the needs of all our students, but also be required to annually reflect on what objectives were being met and what needed improvement. When we realized that something wasn't working, we would always reevaluate, reinvent, and reinvest to make sure the mission was a reality for all. In the case of this decision by the Board of Trustees and the leadership of UMass, I can't help but feel that rather than reinvent and reinvest in the people they espouse to serve, they have chosen the easy way out and have decided to abandon us rather than work with our elected leaders and us to create a forward-thinking, sustainable model that can not only meet their mission statement, but build upon the long-standing history of providing high-quality care at a local level. While our elected leadership is spearheading the efforts to save this vital service, please know that all citizens of the area are behind their efforts to stop this destructive pattern of eliminating essential services that makes our community hospital a full-service facility capable of meeting the needs of everyone. Over 100,000 people will be affected by this effort to dismantle our hospital one unit at a time until we're only left with emergency services. I want to thank you for coming to Leominster this evening to listen and learn the plight of our citizens in this important matter. I know that you will listen and, most importantly, hear and take to heart the statements from the people of these communities that need this vital service to remain intact at our community hospital. It is disappointing the name of Leominster has been stripped from the building's facade and it has been rebranded as UMass Memorial Clinton Hospital. Is the UMass hierarchy confused as to where the campus of the Leominster Hospital resides geographically? I can assure you that no one in this room this evening is confused about our location of our Leominster Hospital and its importance to our region. Thank you.
Thank you. Sharon DeCecco?
I relinquish my time to the next speaker.
Thank you so much. Next is Irene Hernandez, and after that, Eladia Romero.
Hello and good evening. My name is Irene Hernandez, I-R-E-N-E-H-E-R-N-A-N-D-E-Z. I am a resident of Gardner. My children were born at Leominster Hospital. I am the co-chair of the Community United for saving labor and delivery here in Leominster. I am a representative of the Wampanoag and Pokanoket Nation and from the Taino tribe as well. I am very upset because before we begin, we need to understand this is a gentrification of essential services. DPH allowing UMass to take away my right as a woman of color, BIPOC woman. It is predatory, it is discriminatory, and you're killing our community. The data already shows here in North Central Massachusetts the high morbidity rate in Latino women. Look at our community. And as the man behind me said, 100,000, no, we serve over 200,000 people, Leominster Hospital does. The reason why I'm here today is because in 2017, my daughter was brought to Leominster Hospital via an ambulance with a placenta abruption. My daughter was hemorrhaging. She was very pregnant. Had it not been for the experts in labor and delivery, my daughter and my grandson, Carmelo, that's his name, if you want to know, they're alive today. When I say this to you, my daughter was not going to be able to be stable or stabilized in order to send her 30 minutes away, 40 minutes away, an hour away, because this was in the winter. This is December of 2017. So we're not talking about a quick ride to UMass, a quick ride to Haywood. That was not going to happen when my daughter was hemorrhaging. When we think about these things, we need to think about, Dr. Cavagnaro, you said, hey, health equity is a priority. Make it so then. Essential services gets to stay here. UMass and the trustees do no harm. Go back to your days in college when you were studying. The reason why you guys became health professionals. Each one of you, think about that. And if you have children, if you have grandchildren, think about them and their future. Perhaps won't affect you, but I know it's going to affect all of us here. And we need to think about the burden already at Leominster Hospital. There's people that sit in chairs in the hallways at the emergency room. I am a program director of an adult day health center. During the day when I call, there isn't ambulances available. What are we going to do? That $1 million that you guys are going to put aside for transportation? Gone. Then it's going to come back on us for a PT1 service through Mass Health and Medicaid. Why? We need our essential services to stay here in Leominster. When we think about what happened to Fitchburg, it's exactly what's happening right now. We don't have a cardiac unit, we don't have pediatrics, and we don't have a thoracic surgeon. We got rid of them too. What's going to happen is that these essential services to keep our communities alive are being stripped, and they're killing us. And I will leave this. It is painful because I've seen many people die because of health equity, no health equity, because of the deserts that corporate hospitals, instead of community hospitals where our tax dollars, right, they're corporate now. The decisions that they're making are not based on me living, my community living. So I ask the Department of Public Health to support us, to put your teeth in this, and to stop the closing of essential services, because what's going to happen in another year or two, listen, they're going to close our hospitals. There's going to be no hospital left in Leominster if we allow this to persist. Thank you.
Thank you. Eladi Romero.
I am, yes. Eladia Romero, E-L-A-D-I-A. Last name is R-O-M-E-R-O. I have my son Christian with me. So I am a resident of Leominster. I am also a co-chair of Community United to Save Labor and Delivery. But tonight, I'm here speaking as a mother. I gave birth to both of my children in Leominster. But on February 19, 2014, I was pregnant with this guy right here, Christian. I showed up in the ER in Leominster, which is 5 minutes from my house, 31 weeks and a half pregnant. I was told I was in labor. There was no time to transport me to Worcester. I had to give birth at Labor and Delivery in Leominster, and they saved our lives. Had we had to go to Worcester, had there been no Labor and Delivery, my son and I may not be here today. So after September 22nd, if a woman shows up in the emergency room and she's not able to be transported, she's going to be forced to give birth in the ER. Those of us who live in the community know our ER is overcrowded. The staff there is overwhelmed on a regular basis. We don't even know if the ER staff is going to be equipped to handle these emergencies to save lives when necessary. I want to speak to the issue of transportation. Community assessments, including the ones conducted by the hospitals, show that transportation has been a barrier to accessing health care for some of our most vulnerable community members. This plan requires women to travel 30 or more minutes to give birth when we know that the region has an issue with transportation. It is irresponsible to create a plan that further burdens our most vulnerable community members. We hear UMass has pledged $1 million to transportation, but once it's exhausted, what options will be available to those needing transportation? Once again, this decision is irresponsible. And we really hope that the hospital will reconsider this decision. If it isn't a financial decision, then we believe that the problems can be fixed if we work collaboratively to come up with a solution. Because one life lost is one too many. And with this plan, people will die. Lastly, I want to highlight the poor communication of the hospital with the community. No information about the proposed closing has been disseminated in our community in any language other than English, and that's bare minimum. We had to provide materials to our community in other languages, Spanish, Portuguese, Haitian, Creole, so that they were aware of the plan. Most people in our community didn't even know what was happening, including women who were pregnant and who were going to be impacted by this decision. So we ensured that the materials were available to everyone. In fact, We advocated to ensure we had interpreters here tonight so that everyone in our community had access to this meeting, so that everyone had an opportunity to participate this evening. So I ask that DPH mandate that the hospital provide information about their plans and future plans to close labor and delivery in the languages of the clients they serve. Thank you.
Thank you. Next is Amy Gagnon and Evan Croto.
Hi, my name is Amy Gagnon, A-M-Y-G-A-G-N-O-N. My name is Amy Gagnon. I've been a registered nurse at Leominster Hospital for 12 years. I work in the labor and delivery unit and run the hospital's neonatal resuscitation program. The closure of this unit, if allowed to go through, will have a devastating impact on the mothers and babies of northern Worcester County, as there is currently no plan in place for caring for them once they arrive to our ER. We currently had a mother come to the unit 31 weeks pregnant in active labor with advanced dilation who was a booked repeat C-section. We quickly got her prepped and ready for the OR, performed her C-section, and stabilized her baby. The NICU was called because her baby was premature and would need further specialized care. We then called UMass to transfer the mother so she could be with her baby, and we were told they could not take her because no beds were available. I have had several similar nights trying to transfer moms where I am told no bed is available, one being this past weekend. We then called our administration and asked them what they would do if this was October, and a similar case presented to our ER, and our unit was closed. They told us we would put her in an ambulance and send her to UMass. You cannot put a mother in active labor with advanced dilation in an ambulance. There are federal laws around this called EMTALA. EMTALA requires any patient who comes to a dedicated ER requesting examination or treatment to have appropriate medical screening examination, or MSE. Who will be providing this MSE? Every U.S. hospital with an emergency room has a duty to treat their patients who arrive in labor, caring for them at least until delivery of the placenta after the baby is born. Who will be doing these deliveries, and what if they become complex? Currently, there is no one trained to do a proper MSE on a pregnant patient in our emergency room. An MSE for a pregnant patient should include a check of fetal heart tones, measuring contractions, determining the baby's position and where the baby is in the birth canal, checking the woman's cervix to see if she is dilated, and seeing if her water has broke. Has the ER trained any of our current ER staff in this? No. In 2017, UMass decided to close labor and delivery at Harrington Hospital like they are trying to do to us today. They promised to keep their local OB offices in Sturbridge and Spencer and promised to see patients both prenatally and postnatally at these offices, but now they would have to deliver at UMass in Worcester. They were successful in closing their labor and delivery unit, and within weeks were delivering babies in their ER, according to one of our current ER physicians. Fast forward 6 years, and they are trying to do the same thing to our hospital. They are offering to keep prenatal and postnatal care open in Leominster, and if this closure is allowed to go through, our patients will now have to deliver at UMass in Worcester, like the Harrington patients. A unit that is already busting at the seams and refusing to take patients because they are full. According to a quote from one recent patient who was seen there and then sent home and later came back to us. It was horrible. I will never go back there. They had me waiting in a wheelchair in the hallway. Moms were laboring in the hallway, and even though I was in pain at 3 centimeters, they told me I could not be admitted till I was 5 to 6 centimeters.
Thank you.
Okay. According to a quote from one recent patient who was seen there and then sent home and later came back to us, "It was horrible. I will never go back there. They had me waiting in a wheelchair in the hallway. Moms were laboring in the hallway, and even though I was in pain at 3 centimeters, they told me I could not be admitted till I was 5 to 6 centimeters dilated." I don't know about you, but to me, this sounds more like a factory than a birthing center. What will it take to get people to understand they are purposely funneling these patients to UMass to boost profit over patient care? Harrington serviced a population of only about 20,000 people. Worcester services a population over 300,000. And Leominster services a population over 100,000. How can you safely have all these patients delivering on one unit that is already busting at the seams? Why are we, the communities of northern Worcester County, being affected? Why are essential services being taken away from us? We're a population of economically disadvantaged and minority patients, patients who are on Medicaid, Mass Health. It is well known across the United States that hospitals are funneling these patients to large tertiary care centers as a means of boosting profit, but this is being done at the expense of patient care. Many of our patients lack the means to travel to Worcester. It will mean mothers will be delivering in our already overcrowded ER or in the back of an ambulance or on the side of Route 2. Within weeks of UMass closing labor and delivery at Harrington Hospital, patients were forced to get care in the ER. According to a hospital staff there, a patient had given birth to a baby in the hospital parking lot. The baby was born 23 weeks, just at the age we consider babies to be viable or compatible with life. Babies born this early have a 60 to 70% chance of survival, but only if they are delivered under ideal circumstances. He was not born under ideal circumstances. He was born in an emergency room, not on a labor and delivery unit with a team of people that deliver babies every day and are ready to care for these types of patients. He did not have the proper resuscitation equipment there and ready for him, nor will the babies of northern Worcester County if this closure is allowed to go through. Babies born at 23 weeks have immature lungs and lack a slippery chemical called surfactant in their lungs. This can lead to trouble breathing and potentially fatal lung damage if they are not treated and given oxygen properly at birth. My role as a neonatal resuscitation instructor is to teach Leominster Hospital employees how to stabilize these babies after birth. There are 5 people needed at a delivery to resuscitate these babies: a pediatrician, a nursery nurse 1 who assists in intubation, a nursery nurse 2 who acts as a runner pulling meds, assisting with umbilical access, a respiratory therapist, and a recorder. How will the Leominster ED manage this when all of the above personnel, except for 1, will be gone? My current staff are all trained and very well versed in neonatal resuscitation. The plan at closure, if allowed to go through, is just to recommend training but not require it in the ED, as evidenced by an email that was sent from the ER nurse educator to all of the ER staff, and no mention of it at all for ED physicians who would now be expected to intubate term and sometimes very preterm neonates as young as 23 weeks. The American Academy of Pediatrics has flat out denied me to train local firefighters, EMTs, and paramedics, saying they lack delivery room experience and they are not in-hospital personnel, further highlighting how this closure, if allowed to go through, will affect the most vulnerable in our community, those that cannot even speak, the babies of our community. Our community deserves a labor and delivery unit. It is time for administration to give the people of Leominster and Fitchburg their hospital back. I want to thank you for your time and listening to me and urge you to keep labor in Leominster. Thank you.
Evan Croteau.
Good evening. My name is Evan Croteau, E-V-A-N-C-R-O-T-E-A-U. I currently work as a critical care technician in the emergency department at Leominster Hospital, as I have for the past 2 years. Prior to that, I served as an EMT for MedStar Ambulance for 11 years, serving the cities of Fitchburg and Leominster and the surrounding communities. In that time, responding to over 10,000 calls for service, only 3 were for an obstetrical emergency that resulted in a delivery of a child in the field. Closing the birthing center will not only endanger the health and safety of birthing mothers and their newborn children, but it will put a huge strain on local emergency services. When a child is born outside of the hospital and delivered by emergency personnel, the EMS crew now has 2 patients to care for instead of the 1 that they responded to. Requiring additional resources such as a second ambulance or additional fire department personnel, it puts a huge strain on the resources in this area. Increasing the transport times from roughly 5 to 15 minutes in the Fitchburg-Leominster area by 30 to 40 minutes, depending on what the destination hospital is, will take those additional resources out of service for upwards of an hour or more in vulnerable communities surrounding Fitchburg and Leominster. This may not be felt as much in larger cities and towns that have multiple full-time personnel, multiple ambulances, and multiple resources. However, in our surrounding smaller communities that rely on on-call or volunteer personnel, this will leave the community without ambulance or fire department coverage in some cases for an hour or more, endangering the residents of those communities. On the topic of ambulance coverage, our emergency department is regularly having to wait hours for ambulances to transport patients in need of specialty services, causing a delay in patient care. This further endangers the mother and the newborn child, as the emergency department is also not designed to nor prepared to deal with difficult childbirths. Emergency personnel receive minimal obstetrical training and are able to deliver only in the perfect circumstances with a normal presentation of delivery. The emergency department is designed to assess and stabilize acute illnesses and injuries, and then to refer you to a specialist or PCP for follow-up care. Our specialty is emergency medicine, not obstetrical medicine. Closing of the birthing center will also mean that we will no longer have a pediatrician in the building 24 hours a day who can come to the aid of the emergency department when the need arises. In closing, I would strongly urge the hospital, its administration, and the Department of Public Health to reconsider this closing of the birthing center at Leominster Hospital. I'd like to thank everybody who came to show their support for the birthing center.
Thank you. Next is Rob Volpe. Following is Amy St. Jean.
My name is Rob Volpe. I had a whole speech, VOLP, sorry. I want to yield to the nurses that have a lot more to say than I do. One of my child was born here in Leominster. My other child was born at Emerson. Emerson's a renowned birthing center, frankly, because they have a better marketing system. The biggest difference is a hot tub, okay? So, with that said, thank you to all the nurses. Thank all your help, and bye.
Thank you. Amy St. Jean.
Hello, my name's Amy St. Jean, AIMEEST.JEAN. I have been a registered nurse at Leominster Hospital for 29 years and worked there previously while I was going to school. I have been there to witness the merge of Burbank and Leominster in 1993, the closure of the Burbank Mental Health Unit in 2010, the closure of Burbank Rehab Unit in 2011, the closure of the Burbank Urgent Care Cardiac Rehab Program in Leominster, and the Leominster Pediatric Unit, which I worked on for 6 years, all in 2018. I have witnessed numerous reductions in force in the emergency room. I have witnessed reductions in force in the PACU in 2019, and reorganizations in the ED as well as L&D and maternity, even in the thick of the COVID pandemic in 2020. And here we are losing yet another entire department. Where does it stop? We have been told by administration that this closure is a good thing for the community. How can UMass continually and systematically removing local access to critical services possibly be a good thing for our community? I was born at Leominster Hospital. My children were born at Leominster Hospital. My children are now having children of their own. We are people with resources. We have choices. We can decide to go wherever we want to go for our health care. I cannot think of many other services more essential to the care and growth of a community than bringing babies, the literal future of our community, safely into this world. Access to health care is imperative and directly correlated to outcomes. The stark reality is that Health Alliance Hospital in Leominster serves a very large demographic of marginalized people, low income, people of color, people who don't speak English, and of course women and children who have always been and will always be second-class citizens. There are so many community members that do not have the same resources that those like myself are more privileged to have. This fight is for them, the members of our community that struggle with lack of resources and support, lack of access to transportation, people that are already struggling and taking ambulances to come to Leominster Hospital emergency room for even minor illnesses because it's their only recourse for transportation. There are families who will be, sorry, I lost my place. These patients have difficulty finding transport at all, never mind having to drive another 25 to 30 minutes for a total of up to 50 and 60 minutes of travel for many of the outskirt communities. People on the other side of Ashby will be traveling at least an hour on a good day to get to Worcester. Many of our people, if they have a family car at all, only have one. UMass is about to widen the gap in healthcare disparities this population is already struggling with. The population that needs and that depends on this access within the community the most. In a time when the maternal mortality rate in the U.S. is rising dramatically, and we are among the highest of all other industrialized nations, we must make them listen. Closures such as this are not the solution. We should be doing everything we can to retain these services for our community. I implore Eric Dixon and the rest of the UMass administration to reverse this decision and work with us and the community to come up with a feasible plan to keep maternity services in the community, to leave labor in Leominster. Thank you.
Thank you. Next is Joe Bowen, followed by Miko Nakagawa.
Hi, good evening. Thank you for your time tonight. My name is Joe Bowen, spelled JoeBowen. I'm a longtime resident of the city of Fitchburg and currently running for city council in West Fitchburg's Ward 3. In my conversations with residents during my campaign, I bring up the closing of the birthing center and find that 100% of them are against this decision. Reasons cited are many, but a couple I thought I would bring up because I haven't heard these yet, is that the extra travel time to the next closest facility could endanger the lives of babies and mothers, which actually people have said. But the other thing was that residents are less likely to consider starting or growing their families due to the distance from critical services. Additionally, I'm concerned about the work we've been doing as a city to establish ourselves as a place to live, work, and invest, which includes the invitation to come here and start or grow your family. The lack of a local birthing center discourages people to come here to do all of that, putting all our other initiatives at risk of delay or failure. Lastly, I do encourage you to research the data on the decline of the use of the birthing center, since it was stated as a reason for the decision to close. I know this has been brought up before, but I would like to point out that as the population of North Central Mass has been growing, I do suspect that there are operational decisions made by the hospital that have led to the decline versus the lack of mothers having children in this area. Thank you for your time.
Thank you. Miko Nakagawa.
Thank you. My name is Miko Nakagawa, M-I-K-O-N-A-K-A-G-A-W-A. I am the chair of the Mass Nurses Association Nurses at Leominster Hospital, and I've been a nurse at Leominster Hospital for 25 years, 20 of it was spent in the emergency department. I would like to thank the DPH for being here to listen to the testimony of all these lovely people who are very passionate about their community. And though I might not live in this community, I am also very passionate about this community. I have taken care of many, many mothers, fathers, sisters, brothers in the emergency department. And this closure of the birthing center is going to also impact other areas of the community. The private and public EMS systems are already strained. Each time a 911 call goes out for a labor call, it requires 2 ambulances. 2 ambulances that are taken out of service for a minimum of 2 hours. It will take it'll take mom and baby. Baby travels, if the delivery happens in the field, it travels in a separate ambulance to the areas of Fitchburg, Westminster, Lunenburg, and other areas. And the chief of the Westminster Fire Department was here earlier to speak, but he got called out on a call. If there's a car accident while these ambulances are out, that takes another truck, and then somebody else calls 911 for chest pain, stroke-like symptoms, and there's not going to be enough trucks out there. It also, a lot of times, they dispatch an engine because they need all hands on deck. It also requires a police detail. And if the police are the first on scene, then they're going to be delivering in the back of their cruiser if everybody else is out on calls. In their judgment, EMS providers can't safely make it to the birthing center, and they will go to the nearest already overcrowded emergency department in Leominster, where I have worked with some of the best nurses and physicians that you could ever imagine. However, most of them are gone. I'd also like to address the fact that the birthing center at Memorial was not created for your everyday births. It was supposed to be a high risk, and so they are inundated, and they have moms laboring in their hallways. I don't think anybody has spoken to that. There are moms that are laboring in their hallways that by the time they make it into a room, they can't even have the benefit of an epidural. That's shameful. How has UMass allowed this to happen? The birthing center at Memorial is one of the highest rated in New England. They do excellent work, but their job is to take care of the high risk. The community hospital's job is to get people there when they need to get there. Without the pediatric hospitalists for babies when they're born in the emergency department, the overwhelmed emergency department may miss something. That's not their fault. They just don't have enough hands, outside of the fact that you took some of their hands away. Where is the moral compass here? I'll say it again. Morally, this is wrong. People are going to die from this decision. Not just mothers and babies. Other people in the community are going to die. People are going to be blamed who shouldn't be blamed for things that don't happen the way they should. In closing, I'd like to say the community of North Central needs their birthing center at Leominster Hospital, especially with the growing population. It's not shrinking. Babies are still going to be born. We are asking that you deem the birthing center an essential service, and we implore you, Mass, not to abandon this community. Don't devastate this community. I've worked really hard. I've taken care of a lot of people. Thank you.
Thank you. Next is Veronica Diamond, and then Susan Buckholz.
Hello, my name is Veronica Diamond, Veronica Diamond, and who I have with me right now is my 2-month-old daughter, Raylan, who was delivered at Leominster Hospital. I had Raylan after 17 hours of labor via cesarean section because they believed that it was the right choice to do for her to live. Ironically enough, a fun fact is in the delivery room that I was in was 24 years ago, I was born in that room, the same room that my daughter would have been born into. Another fun fact is that not just her or I was born there, but my 7 younger sisters were also born there as well. It's a family that everybody was born there. An old saying my mother says is that us Italians like to multiply. And we're also very stubborn because during those 17 hours before they decided C-section was the best way to go, I had stopped progressing at 6 centimeters. And being as stubborn as I was, I wanted to have a natural birth with her, but they talked me into saying that her heart rate was decreasing, so they decided C-section was the best way to go. So I did, and her being as stubborn as myself, decided to breech herself and wrap the cord around her neck while she was being born. She came out feet first instead of head first, and if it weren't for the amazing nursing and doctor team and everything, I watched them resuscitate her because she came out stunned. She wasn't breathing, she was blue in the face, and they pretty much saved my daughter. I was able to hear her give her first cry, and they wouldn't move me until I could be able to kiss my daughter for the first time. I told them I didn't want to move or anything until I got to kiss my daughter. Another story that I want to say briefly is that out of the 7 siblings that I do have, my mother, within 45 minutes of her water breaking, my little sister Isabel was born, my daughter's godmother. She would not have made her debut into the world if Leominster Hospital's labor and delivery ward was inaccessible. She would have been born in the back of an ambulance or in a car to get to the closest hospital that had labor, postpartum, and the care that she needed. As a first-time mom, I myself have had made a few scares where I've had to use the labor and delivery care a few times during my pregnancy. On March 15th, 2023, I had slipped and fallen on ice during our most recent snowstorm. I landed on my stomach, and I could not feel my daughter kick. I rushed to the closest hospital, which happened to be Leominster Hospital, and they took me in immediately as soon as I walked in those doors. They put the heart monitors on because I couldn't feel her kick, and assured me constantly that she was still alive and that she was okay. They constantly checked on me and her every hour because she would move and couldn't feel or see her heartbeat because she would move every 5 seconds. But they made sure constantly that me and her were okay. Closing, because I don't want to take up too much time, I know getting rid of Leominster's labor and delivery and postpartum ward is a bad choice because my daughter's future siblings, cousins, hell, even my future grandchildren deserve to be born close to home. Thank you. Thank you.
Susan Buchholz.
Hi, my name is Susan Buckles, S-U-S-A-N, Buchholz, B-U-C-H-H-O-L-Z. I was born in Clinton Hospital, which is located in Clinton. I had my child in Leominster Hospital, which is located in Leominster. I am a lifelong resident of Massachusetts, and I've worked in nonprofits for my entire career, now 40 years. I understand how nonprofits work. I also work for a Leominster nonprofit, the Spanish American Center. I supervised a team of domestic violence advocates, and guess what? We kept operating during COVID, and guess what? We have staffing challenges. But we don't stop serving our community. I was here in this area, and I watched UMass in a hostile takeover of Burbank Hospital and then kill that hospital by a death of 100 paper cuts. And each time we were told, trust us, we care about you. We're gonna make sure that these services don't close until the next closure and the next closure and the next closure. And now we see exactly the same thing happening in Leominster. You ask us why we don't trust you. Are you kidding me? You talk about how much you value diversity. Do you know what diversity looks like? It looks like this community. You know what diversity does not look like? You. I, too, am extremely disappointed that Dr. Dixon did not have the ovaries to show up tonight. But if he was here and he was sitting with you, it would not change your commitment to diversity one bit, because you would still be an all-white group of mostly men and people who don't have to worry about giving birth anytime soon. It's disgusting, that's right, it really is. What we are asking for is not radical. We are simply asking that you, our Department of Public Health, hold nonprofit hospitals. You are a hospital. You are not a corporation, but you act like a corporation. That you hold nonprofit hospitals to deliver the minimum standard, just the minimum standard of first do no harm. That's all we're asking. Stop killing Black and brown people. That's all we're asking. Thank you.
Thank you. Next is Jessica Capucci, and After that, Steve Curry with Victoria Seltzer.
Good evening. My name is Jessica Capucci, Jessica Cappucci. I've been a registered nurse for 21 years. I've been employed at Health Alliance Leominster for the past 10 years in various departments. I currently work in the maternity unit, and I am very concerned about the intended closure. When I transferred to the maternity unit, I was told I would receive training in both the postpartum and labor and delivery units. Yet it took 1 year to even begin my orientation to the labor and delivery side, despite the great need for overnight coverage there. Another nurse was hired to staff both units, but never even received an orientation to the labor and delivery side. Administration cites staffing shortages as a reason for closure, yet these examples highlight the fact that there was no urgency to fix them. I have also worked in the emergency room in Leominster for the past 6 years. The Twin Cities of Leominster and Fitchburg and surrounding comprise a population of over 100,000. And with other hospitals being 30 minutes away at minimum, I am concerned women will find themselves stranded in our ER, laboring, or with an obstetrical emergency. This past year, we have had several women deliver in our parking lot. Also, we regularly deliver patients at our hospital who are en route to Worcester or another hospital. If women can't even make it into our building now, and we are already delivering patients intending to deliver elsewhere, it seems likely it will only get worse when we close. Just this past week, a patient set to deliver in Worcester was brought in by ambulance crowning. She delivered in our emergency room, thankfully with staff from the labor and delivery unit, but with limited privacy and without the comforts of a specialized unit. Administration claims once our unit closes, they can easily direct ambulances to bring all laboring patients and obstetrical emergencies to other locations. However, ambulances are operated by licensed emergency medical personnel who must consider their protocols, patient presentation, risk of harm, and scope of practice. As in the above case, if birth is imminent, they will divert to the nearest emergency room regardless of if there is an on-site maternity unit there. Those ambulances which are able to continue on to another hospital would be out of service to the Twin Cities for 90+ minutes or more, further complicating our local EMS shortages and lack of available transports. As a trained labor and delivery nurse, as well as an ER nurse, I can attest that an ER nurse is not sufficiently prepared for the laboring patient and/or an obstetrical emergency. It is unfair to place this burden of care on the ER nurse. They also do not have the equipment or training to monitor the mother and fetus prior to delivery to definitively prove fetal and maternal well-being in labor. And despite what administration has stated, NRP, neonatal resuscitation program, is not the standard of care in our ER. It is not required. If the maternity unit closes, we lose the majority of our NRP personnel qualified to resuscitate neonates as well as those, and we also lose those who are certified to teach. Administration and the chair of obstetrics, many of whom have never even set foot on our unit and did not even give staff the courtesy of a discussion prior to issuing a closure notification, claim that we can no longer safely care for mothers and infants at Leominster Hospital. But is it safer for them to deliver in a parking lot or on the side of the highway? Is it safer for patients having a concern about their pregnancy to drive 30 to 60 minutes to be evaluated and monitored? Is it safer for patients to arrive at Worcester area hospitals that are already beyond capacity to be left in hallways to labor? Is it safer in a suspected placental abruption to risk waiting for ambulance transport or to travel 30 more minutes down a highway to obtain life-saving cesarean delivery when our qualified obstetricians and OR team will no longer be available at Leominster Hospital? Is it safer for the 24-week neonate delivery in the parking lot to receive resuscitation from providers who have not received specialized training in the care of micropreemies when administration will discontinue our 24/7 in-house pediatric coverage? It seems the administration's reasons for the closure change every day, but all their reasons are resolvable problems and not justifiable reasons to close the unit. I'm a Leominster resident and delivered all 4 of my children at Health Alliance Leominster. I am very grateful to have received competent, quality care so close to home. Please, if it is within your power to do so, reverse the decision and leave labor in Leominster.
Thank you, Steve Curry and Victoria Seltzer.
Good evening. My name is Victoria Seltzer, Victoria, last name Selser. I am the epidemiologist from the City of Fitchburg Health Department. I am also fortunate to serve 12 other cities and towns, including the City of Leominster. I'd first like to commend the efforts of the North Central Mass Delegation, the MNA, Leominster Hospital nurses, and all involved community members and organizations for these efforts to preserve maternity services at Leominster Hospital. The decision to close labor and delivery services at Leominster Hospital will have immediate and devastating impacts on the health and well-being of community members in the Twin Cities and surrounding towns. As you will hear this evening and have heard this evening, there are significant concerns about the time and distance expecting mothers will need to travel to access maternity care, potentially while under the time pressure of labor and delivery. In order to travel that time and distance, though, expecting mothers will need access to reliable and readily available transportation. According to census data, 12.8% of households in Fitchburg do not have a vehicle. This is above the state average that is already the 3rd highest in the nation. Without transportation or facing an emergency, there will, without a doubt, be expecting mothers seeking emergency care in the emergency room at Leominster Hospital. The emergency room is already understaffed and overcrowded. In fact, according to the Center for Health Information and Analysis, the average length of stay for emergency department visits at the Health Alliance Clinton Hospital System was the 5th longest in the state in the last quarter of 2022. This is a metric that is indicative of ED burden. I would like to close with the words of Dr. Paul Farmer, late physician and anthropologist. If access to health care is considered a human right, who is considered human enough to have that right? Thank you.
Thank you. Steve Curry.
Good evening. My name is Stephen Curry, StephenCurry, Director of Public Health for the City of Fitchburg. So I would like to refer to a DPH brief that came out in July. I believe Councilor Zephyr referred to that earlier. But for every maternal death, there are about 100 episodes of severe maternal morbidity, which is termed SMM. It affects more than 50,000 birthing people in the United States and about 400 of birthing people in Massachusetts every year. Experts define SMM as unexpected complications of labor and delivery that results in significant short or long-term consequences to the birthing person's health. SMM includes life-threatening conditions, as we know, such as heart attacks, kidney failure, amniotic fluid embolism, disseminated intravascular coagulation, and sepsis. It also includes life-saving procedures used to manage serious conditions, such as the machine to help with breathing or removal of the uterus. Reducing maternal death and SMM was a Healthy People 2010 and 2020 goal. It remains one of the goals for Healthy People 2030. However, limited progress has been made in achieving these goals. The prevalence of severe maternal morbidity nearly doubled in Massachusetts from 2011 to 2020. Closing the birthing center here and forcing birthing folks to travel an extra 20 to 40 minutes does not align with DPH's goals or Healthy People's goals to reduce severe maternal morbidity. Thank you.
Thank you. Next is Milry Keeling, and after that, Amy Ebbison. And I'm going to remind people, if you can please keep within 3 minutes, and we will just make it before they close us out of here. Thank you.
I'm Milree Keeling, M-I-L-R-E-E, last name K-E-E-L-I-N-G. And this will be a little choppy because I probably had 4 minutes, so please forgive me. But thank you for coming to hear our testimony tonight. And thanks to the people who have spoken so eloquently in this room tonight about the issues of safety that are inherent in the closing of the closing proposition for this unit. I'd like to talk a little bit about accountability for decision-making. Okay. You've heard UMass Memorial Health Alliance Clinton Hospital blame the decision to close the inpatient maternity service on labor shortages, staffing challenges, a developing shortage of physicians, and declining volume of deliveries since 2017. These excuses are provided without context or accountability, as if they just happened to the hospital. So they have no choice but to close. Why? Why for each one of these? Why did they happen? Well, I believe this crisis has been allowed to develop over many years, over 20 years, and is the result of institutional failure. In 1987, Burbank Hospital privileged 2 certified nurse midwives to open the cottage outpatient birth center. This was an innovation, okay? I was one of them, and this is my long perspective. Our midwifery physician practice brought 600 annual deliveries to Leominster Hospital when the 2 hospitals merged. That joined the 400 at Leominster Hospital. Over the years, I also worked to sustain midwifery at other local practices. Health Alliance Hospital itself, as it acquired community practices, employed midwives doing deliveries, but they were let go around 2012, 2013. But not because midwives weren't available to work, or because women didn't want midwifery care. They were busy. They just were not valued enough to support. Yes, women are having fewer babies. In 2019, which is the last year for which the Department of Public Health has provided birth statistics to the General Court, there were 25% fewer births in Massachusetts than there were in 2007. Maybe that explains the steep decline in births at Health Alliance Hospital. A closer look suggests a different story. During that same period, from 2017 to 2019, only 14% fewer babies were born to parents who live in Fitchburg, Leominster, and the towns that directly border them. The women are doing their part here, okay? That's about half the statewide decline. However, between 2007 and 2019, the number of babies born at Health Alliance Hospital declined by 51%. From 1,113 to 564. Haywood Hospital showed a 33% decrease, but 2 hospitals with active midwifery services show a very different story. Emerson Hospital increased their numbers of births by 15%, and St. Vincent Hospital increased by 6%. In the face of a 25% statewide decrease in number of babies born, I have questions. Is it the walnut paneling at Emerson? Is it the waterfall down at St. V's? Do you know the answer? Clearly, many women leave, and they are leaving to have their babies. Why? Why do those who remain stay? There's only one way to know the answers, and that's to ask the women. And who's been asking the women? Over all these years, who's been asking the women? Has the hospital noticed, or did they care to investigate this impact on an essential service? What has the hospital done to retain births in the community? The UMass Memorial Health Alliance Clinton Hospital publicly promotes its commitment to community engagement, and I applaud that. The hospital is working with the community to plan and deliver mental health care, hospital in-home care, outpatient services, and emergency services. And I do believe that makes a difference. But there are two constituencies that have for many years only been brought to your table to be told what they must accept from the hospital. Two constituencies who have not been invited to any table to find out what they need to keep community births in Leominster. The childbearing women and the people who care for them. I hate to think that no one even thought to include them as you planned to address this very real problem. After all, in 2021, the CEO of the hospital publicly called UMass Memorial Health Alliance Clinton Hospital a jewel of the community. And he's not wrong. The hospital can do better and should do better by its mothers and families. The Department of Public Health has the authority to require an improvement plan instead of approving this closure. I ask you, I beg you, in consideration of the health of my community, to use that authority.
Thank you. Amy Ebbison?
Hi, I'm Amy Ebbison, AMY-EBBESON. I'm a clinical social worker as well as an academic with a specialty in trauma, especially trauma incurred in early childhood. So many people have made the most amazing, comprehensive points, things I've never even thought of, so I really want to try to zero in on things that haven't already been said. And I do just want to point out that the only people that believe this is a good idea are very highly paid to believe that. Right? All of these people make seven-figure salaries. Seven-figure salaries. Our electeds don't make seven-figure salaries. And when I'm hearing from our electeds of the amount of money, taxpayer dollars, given to this group of people, it's outrageous. So that's point one. The second piece is how they go about choosing their victims. They are very intentional in who they decide to victimize. They go for brown and black communities. They go for poor communities. They go for women. I have never felt more vulnerable in my life than as a pregnant woman, right? The most vulnerable population, with the one exception of infants that can't even speak. Could you be any more vulnerable than that? And that's who they're going to target? Not lost on me that this is very intentional on their parts. We heard about the timing of when they did this. This is intentionally, they think we're just going to look the other way. We're not even going to notice the harm they're doing to our community. And that brings me to the last point that I want to speak about. As a trauma specialist, we now know that before you're even born, the experiences you're having are going to impact the quality of your life. When people are traumatized, it's lifelong. Not only are the quality of their life dramatically impacted, it harms their children, right? So if the birth trauma, if you look up birth trauma, all of the causes of birth trauma are preventable. They're from the end of the hospital. I'm feeling like the hospital is throwing around the word health disparity. They clearly don't know what it means, because this is where health disparity starts. This is health disparity. Taking away vital services from pregnant women, brown women, women in this community, poor women that can't get to Worcester. It's disgusting, it's despicable, and I'm so grateful that so many people are calling it out. Thank you.
Thank you. Next is Jenna Montgomery, and then Christine Tingley.
Jenna.
Hi, good evening, everyone. Jenna Montgomery, JennaMontgomery. Good evening. I am here tonight as a social worker and also a public health educator in the North Central Massachusetts region. I'm here to express my concern over the closure of UMass Memorial's Labor and Delivery Unit. As a public health professional, I've been alarmed by the closure of essential services throughout the state, and especially in the North Central area. The resource gap is widening. In particular, I want to share my perspective on how this closure will impact overall public health in surrounding rural communities. I grew up in Townsend, Massachusetts, and many friends and family members still residing here were born at or had children at Leominster Hospital. It remains the single biggest provider of birthing services in North Central Massachusetts. Residents of surrounding rural towns rely on the quality medical care, services, and resources provided in the gateway cities of Fitchburg and Leominster. The loss of Leominster Hospital's birthing center will mean people in our communities, especially those north and immediately east of Fitchburg and Leominster, will need to travel further for care, and in some cases prohibitively far due to financial constraints or lack of transportation. Not to mention all of the strain on the hospitals. You know, everyone has mentioned the 4 that they would be redirected to. There's already a lot of difficulty accessing care at those locations as well. The accessibility of labor, delivery, and postpartum care is an issue of prevention. Public health is about prevention. MDPH data released earlier this month, not to beat a dead horse, but shows that severe maternal morbidity in Massachusetts has nearly doubled in the past decade. The loss of this labor and delivery unit will mean less immediate access to care for those experiencing complications. As others have mentioned, area ambulance services will be strained by needing to transport more patients further. ERs will be strained by an increase in patients, and in some cases, medical situations they're not prepared to adequately manage. Shutting down this service will cause real material harm to real people, and it will disproportionately affect our most vulnerable populations. Thank you.
Christine Tingley.
Hi, my name is Christine Tingley, Kristinetingley, and I am here to represent the pediatric hospitalists at Leominster Health Alliance. And it saddens me that I get 3 minutes, so you will receive our emails. Please attend to them. Statistics, I'm going to try and take the emotions out of this, but this is a really sad and unfortunate situation. The American Academy of Pediatrics offers neonatal resuscitation program, which is well managed and runs by statistics. Of the 500 births that could potentially happen in the coming year at Leominster Health Alliance, 10% of those will need to be resuscitated. Of those 10, 1% will either die or need a full resuscitation. Do you know how much a resuscitation costs? The same for a successful outcome and a dead baby. It's not the women with an uncomplicated pregnancy that walk in happy, skip to my loo with their doula. It's the women who come in crashing off the street. The hardest place to resuscitate a baby is in the community. It needs specialists. What I've been taught is the low volume, high impact scenarios deserve the best and the most interventions. This is hard for me. I'm a product of UMass. I started in the NICU in 1996, and I've been resuscitating babies ever since. I know both sides. I've gotten in an ambulance, driven to Leominster, and taken from them the baby that they've successfully stabilized the best they can with what they have. I'm the investment that UMass sent to Leominster. My medical director in the NICU gave me the opportunity to use half my time there. We were charged with a bad outcome and told to fix it. I showed up, I trained all the pediatric hospitalists to a more stable and consistent resuscitation. I'm a board-certified nurse practitioner in pediatrics and neonatology. I'm not even a doctor. I'm a coupon. You can have coupons in every facility you want. There's a lot of solutions to this, but we weren't asked. I got 3 minutes. There's no accountability. We should have been asked. There's ways to help this. Give us the emergency department, 6 beds they told us about. Staff us from 11 a.m. to 11 p.m. in the emergency room. Make revenue off us. Day Kimball has 300 births a year, and they're staffed by nurse practitioners. Please, we have solutions. We're all willing to make sacrifices. My pediatrician colleagues will step aside for nurse practitioners if it will save the unit. When I win Powerball, I'm writing a check. Like, it's not a joke. Low volume, high risk, the statistics are there. Someone brought up accountability. Accountability to talk to us, ask us our solutions. The nurses aren't leaving because we can't staff them. They're leaving because it's scary, and they're leaving because they don't have nurse leaders.
That's right.
I was brought up at UMass. My love for what I do happened at UMass. I know the resources there. It's an academic tertiary facility with a university system. Unleash the residents, send them to us, we'll train them there. We have ways to do this. You have a whole college full of finance kids. Let them use their innovative minds and help us. We want to help. We want to help. There's sacrifices to be made. The person that said, how much will this cost? What do you need? They didn't come to us. We need an obstetric group that has the passion that my medical director, Matt Mazziello, for the pediatric group has. Please read our emails. They need someone with passion that comes in every day and lights a fire under that place and lights us all up. It's the only baby I haven't been able to resuscitate is Leominster. My entire group unapologetically votes no confidence in the administration at either hospital. I really wish I had more time, but the statistics speak for themselves. How many of those 6 will it take until the Board of Medicine comes after us for baby deaths? I'm sorry that I need to leave, but I worked last night and I have to go back. Please read our emails, and thank you for everything you're doing for them to let them speak.
Thank you. Next is Alexis Knudsen, and then Joshua Klaus.
My name is Alexis Knudsen, Alexis Knutson. Every doctor is aware of the oath they have taken to do no harm, but have we ever stopped to consider that their employers should be held to the same standard? The hospital is a place the community can access life-sustaining treatments. It is now threatening to take away the opportunity to safely give life. Taking away the labor and delivery ward gives a clear message to our community that their value of human life has significantly diminished. The mothers that care for our families that make up these towns are now being told their safety is no longer a concern. Can you place a numeric value on a mother? Can you place a dollar sign on the worth of an unborn baby or pregnant woman who may die to this closure? In a world of ethics and equality, how dare they say their pocket change is worth the lives that make up our towns? I was told 4 years ago I was a textbook healthy pregnancy. My contractions started one morning and I knew we would meet our son. We made it to the hospital. I was writhing in pain. I was met by a nurse who cared for me like her own daughter, and I found out her son had gone to high school with my husband. She also knew my father-in-law, who had worked in the hospital for years. Immediately, we had a community connection, a symbiotic relationship. She was there to nurse me through this, and I was the patient in need. After losing consciousness several times, it was apparent that something was very wrong. I found a dozen healthcare personnel in my room. My son had a severe shoulder dystocia. We all worked together, and through the relentless attention of Lisa Aubin, my son's shoulders were turned, and he was born miraculously healthy at over 10 pounds. Soon after the delivery, I developed postpartum eclampsia. My body convulsed, my blood pressure 200 over 140. I was taken to the Leominster ICU and was cared for there. The L&D nurses and staff worked closely with my ICU nurses, teaching them what they needed to know, and researched safe medications for me. The L&D secretary checked on me regularly, and I was cared for and rooted for by the L&D department. If it were not for the variety offered and teamwork shown at the hospital in Leominster, our story would be very different. Thank you.
Thank you. Joshua Klaus. Okay, Luis de los Santos and Wendy Hardison Moreno afterwards. Carolyn Sellers. Rabbi Eve Eichenholz.
Good evening. I'm Carolyn Sellers, CarolynSellars. Thank you for giving me the opportunity to speak. I'm speaking as a mother, a grandmother, and someone who cares a lot about North Central Massachusetts. When I heard that the Leominster Hospital was closing their labor and delivery unit, I was shocked. It went against everything I've known and read about what we need to do to support our mothers and our families. Families need access to local health care. They need more access, not less. My second shock was a few weeks later when I learned that there's no teeth in this whole DPH proceedings, and that this is just, I'm not sure exactly why we're here tonight and what is going to come out of it. So I guess I should direct my attention to the people from the hospital and say that this is important, and I hope you pay attention to everything people have said tonight. I had two great births experiences at Burbank Hospital in the 1980s. It was a 20-minute drive from my home in Townsend to Burbank. It would be about an hour drive to Worcester or to Emerson on a good day with no traffic. I don't even want to think about what rush hour would be like, someone trying to go through the Concord Rotary. This is ridiculous. One of my babies needed to stay in the hospital for jaundice for a few extra days after I had to be sent home for insurance reasons. They wouldn't pay anymore. I was able to make frequent trips home from the hospital to my home to see my son and be able to feed him, and also to be with my older daughter who was home looking to see her mother. This would not be possible. I could do this because I had a car and I was close. When I think about families having to deal with this going to Worcester, who may not have a car, I just can't imagine. In the last 4 years, 2 of my babies have had babies of their own out of state. Their pregnancies advanced normally, yet at the very end, there were complications on both that left both with extended hospital stays. In one case, it was for the baby's sake, in the other case, it was for the mother's health. The help and support of friends and families, including visits to the hospital, was critical to their mental well-being during this time. So this brings me to talk about transportation. I spent the last week reviewing and commenting on the regional transportation plan for our region, the 2050 journey for North Central Massachusetts. Transportation options in our region are very limited now. Transportation to Worcester or Concord are non-existent. And these are not being mentioned in the 2050 plan for the future. So for mothers seeking prenatal care, there's no transportation. At the time of labor and delivery, there's no transportation. For families wanting to go to the hospital to support their bigger family members, there's no transportation. Strong communities need good access to health care, which starts at prenatal care for the mothers. 40 years ago, my husband and I chose to buy a house in Townsend because it was affordable and a good place to live, in part because it was only 20 minutes from Burbank Hospital. I want to finish off with a couple of other things that haven't been mentioned tonight. It might seem a little weird, but I spend a lot of my time working on climate justice issues in the region. And Massachusetts has made a strong commitment to address climate and resiliency issues. Any closing analysis should do an analysis of how this decision impacts greenhouse gas emissions. It seems like it would be applicable to do that because the state has made making our 2050 net zero a high priority. And how will this impact our region's ability to meet net zero if everyone has to drive further to get places? Finally, we know that our future climate will include more frequent, intense storms like the ones we've been having in both summer and winter. I only can cringe thinking about families having to drive down Route 2 or down Route 190 during ice storms and snowstorms and rainstorms when they could just have stayed in Leominster. Thank you.
Good evening. I'm Rabbi Eve Eichenholz, EVE,
Henholtz. I'm the rabbi of Congregation Agudat Achim, right here in Leominster, arguably one of the hospital's closest neighbors. I come here tonight as clergy. We've heard a lot about people who are in delivery and their labor stories from hospital staff, nurses, community organizers. I want to talk a little bit about where I and my fellow clergy fit into the constellation. We are the ones who work with families, getting ready for a birth, creating a welcoming ceremony. We're the ones who sit next to families in waiting rooms and hospital rooms at the highest of highs and the lowest of lows. We're the ones who are in a room and in a hospital when their support structure can't get there. Like so many who work in the hospital, we're on call 24 hours a day, 7 days a week. But we need to be able to get to our congregants, to our community as well. I have the great fortune of when I'm needed, I can literally walk to the hospital. Could I get there and be there in time for a family making a difficult decision if I had to get to Worcester? What does it mean for us as clergy to be able to support all of our community? I come from a tradition that teaches about pikuach nefesh, translated as saving a soul. It teaches that the single most important imperative is that of health and safety. We sacrifice all other things in Judaism to be able to ensure health and safety. We've heard a lot tonight about physical health and physical safety. But I come from a tradition that teaches that health and safety is more than just our physical bodies. It is our spirit, it is our emotion, it is our financial and psychological well-being. And if any of those are affected, we must consider them all. That's right. I hope that as I, a rabbi, as I, fellow clergy, want to continue serving our communities, we can do so in our community, with our local community hospital, and that we are able to keep essential services right here so that we can all continue to partner and provide the care that's necessary.
Thank you. Next is Michael Terrera, and then Zulona Motave.
Mike Tarara, M-I-C-H-A-E-L, officially. Tarara is spelled T-A-R-A-R-A. My wife's not here. She's home with the kids. But this is her story. My wife had a normal pregnancy for her second pregnancy. Everything was going fine. One day, late in pregnancy, she's feeling, a little less activity. And so she's thinking, I don't know, should I be worried? Maybe. But what she didn't have to worry about was distance. We have the ability. I'm not poor. I'm not black. I have a car. Okay? I understand that. We had the ability, if we wanted to go to Emerson, we had the ability to go down to Worcester if we needed to. The convenience was the time. She's sitting at home late night. We have a kid upstairs in bed, and she's thinking, I don't know. Is it okay? Should I be feeling this? Should I be worried? And I told her, what are you worried about? It's only 10 minutes to the hospital. Go there, they'll check you out. They'll say, hey, you're overthinking it. You'll be fine, and you'll be back here in an hour. She goes there. 20 minutes later, I get a phone call. Get to the hospital. We're having a baby. There you go. There's the difference. She didn't have to think, maybe I should wait till the morning. You know what? It's late night. I don't know. My daughter had a true knot, and she had a cord wrapped around her throat. She had an emergency C-section at Leominster Hospital at 2 a.m. She was born healthy and alive because the option was there. There was no, I don't know if I should go because I have a son upstairs and I don't know if I need to worry about that. 10 minutes in the hospital, had coverage. had a baby healthy because of these ladies right here. All right? It wasn't about money, it's about health. Now, I've got all these other notes here that I've heard about other people talking about $1 million for EMS services, which according to $2,500 per trip gets you, 400 trips to Worcester, which is maybe a third of the year, which is total crap. Births in hallways, which sounds like I'm watching the news about the Ukraine war, not Massachusetts. Massachusetts is the best state in the country, supposedly, for health insurance. It sounds like I'm listening to somebody from Alabama, where there's no support, no structure. Massachusetts has the best in the country, allegedly, but we've got these guys over here with 7 figures not giving an absolute crap about what's going on. I mean, I believe there was a podcast that was hosted by Roach about having community support, community hospitals. Really? Really? Community? Here? When you're giving us nothing? And I know for a fact that as soon as this goes away, they're going to get this literally all the way down to an emergency room, and that is it. And all we're going to have is 11 urgent care centers and 1 emergency room that can't handle anything because it's going to be overloaded. So, that being said, everything that you're going to find out about them not being able to afford it is absolute BS because they cooked the books. They did this last time with pediatrics. They said, oh, well, we've got limited amount of people. What they were doing is intentionally funneling things away. So over the last 3 years, they could look at the books and say the numbers back up the facts. They're cooking the books. It's absolute crap. Dixon can't even be here because he's chicken shit, and you guys deserve to be flipped off for not helping us out in this community, all right? You can all go to hell.
Next speaker is Zulona Malave. Is that person here? And then forgive me, I can't quite read the last name. Dr. Abigail Gyas. Thank you, sorry.
Hello. Thank you for the opportunity to speak tonight. I have, whatever I'm saying, it's actually my own experience with these ladies and gentlemen. Occasionally we have gentlemen working. First year resident, walking to L&D, not knowing trying to get my head out of everything and trying to figure everything out at the same time and getting comfortable not knowing anything. And we had somebody walk in, her water had broken, and within a few minutes, I know I couldn't have done it without them being there guiding my hands at that time to deliver that baby. And I know that without them, a lot of babies would not be delivered the way they should. I've also been on call where I've had the nursing supervisor page when I'm on my 24-hour call at 3 o'clock in the morning because somebody delivered in the emergency room. The nursing supervisor called and also paged. Because guess what? In the emergency room, they were happy. My attendants were happy that I actually was there. Because that's not what they do. At the end of the day, we are all trained to have a certain skill. I'm a nurse. As a beginner, I was a nurse. I worked at UMass for 7 years before I went to med school. My nursing training, part of it was rotating through L&D, but it did not equip me to become an L&D nurse and to support a woman in labor. During childbirth, the team involves a resuscitating team, and there are things to be considered before. you actually have the team. So you have at least 5 people in the room, there for the kid and there for the mother. I also, where the community that I practice my office is at, it's Fitchburg. Majority of my patients do not have access to transportation. And so you cannot put in a PT1 to schedule a delivery to Worcester. Unfortunately, deliveries and babies have their own schedule. Even though they are supposed to be here at 39 weeks, some of them pop their head up on time. Like we had a C-section scheduled on Tuesday, and the baby decided to come on Sunday. And so then her water broke on Sunday night. And so you have running around trying to find somebody, but then you have support and supporting staff to help you deliver. At the end of the day, I have transportation, so I go to Gardner to Hayward. Going to Worcester from here is 30 minutes, and now my patients, majority of them cannot have access, even getting them to come to the clinic for follow-up. Not just that, it's not the pregnancy, it's not a road trip. You have patients showing up in the middle of the night, I cannot feel the baby, or something happened, and they walk up to L&D, and they are taken care of. The emergency room physicians and the nurses are not equipped for this. I know I may not understand the finances, but I do see what happens when life is put at risk. And this decision puts lives at risk, mothers and babies. At the end of the day, majority of the people are going to deliver in the emergency room, and the emergency room is not set up for that. And so I reckon you to reconsider your decision to take L&D away from Leominster Hospital, because the community here, Townsend, Lunenburg, Leominster, Fitchburg, we all rely here on this L&D. Thank you.
Thank you. Next is Nicole Miley, and then Paul Constantina.
Hi, Nicole Miley, Nicolemiley, and I live in Leominster for the past 14 years, and I'm also an ICU nurse in Leominster. This proposed closure truly disturbs me on a personal level. I've had 3 children at Leominster Hospital, and contrary to a statement made in the past by the head of UMass OB, stating that C-sections are more of a convenience versus necessity, mine were all medically necessary. From being past due at a checkup and they couldn't find my baby's heart rate, to having placenta previa and going into labor 3 weeks early, all times being admitted right to L&D and urgently delivering by C-section. And I was fortunate enough, to also have my family to be able to come because they also live here in town. In my opinion and experience, my C-sections were never convenient to me. The plan that the ER is prepared to deliver babies, what about a person in my situations that need an OB urgently, not 30 minutes out because they're on call, and urgent C-sections because they can't find a heartbeat? I had a good outcome, fortunately. My baby lived. Or placental abruption and hemorrhage by trying to vaginally deliver a woman with a known or unknown placental issue. We rely on our 24/7 coverage of OB and L&D and postpartum nurses and pediatricians to be present in these situations, in all situations. As we all know, these kinds of outcomes, positive outcomes, are not always positive. They're not 100% of the time, and that could have very well been my own situation had I not had the ability to go right upstairs from my doctor's appointment to labor and delivery and then to the OR for my C-section. I'm a great nurse. when I'm having a baby, I don't want an ICU nurse or an ER nurse, though they're fantastic and have exceptional skills. I want and need OB staff, and I need it locally. Thank you.
Thank you. Is Paul Constantino here? Next will be Karen.
No, Paul's here.
No, I'm just saying next will be Karen. Thank you so much.
Hi, thank you for the opportunity to speak. It was not my intention tonight, but my name is Paul Constantino, capital P-A-U-L, capital C-O-N-S-T-A-N-T-I-N-O. I reside at 49 Colonial Drive here in Leominster. Father of 3 children who were born at Leominster. And also my wife has been a maternity nurse for 39 years in Leominster. And she's one of these wonderful nurses who are all here this evening. And I came to support her in her efforts and the efforts of everyone else here. So that was my intention, to be a spectator. But as I read the handout that was given to us as we entered the room this evening, and I purposely went back out in the hallway and asked one of the people there who were handing these out, when was this written? And they all said it was just written in the last few days. And I said, are you sure? And they said yes. And I know this announcement was first made on May 25th. And it's the same information from May 25th. There's no specifics. It's all generalities. Despite significant resources invested over 5 years, sincere efforts, we have made investments in recruiting, upgrading the physical facility, purchasing state-of-the-art equipment, et cetera, et cetera, et cetera. All generalities. Where are the specifics? And I know many of the state legislators spoke to that, and Mayor D. Natalie from Fitchburg spoke to that. I know Sue Shalafu-Zephyr, the councilwoman from Leominster, spoke to that as well, so I won't belabor that point. But I do think if you go to the next page, and these are all my own notes I made tonight as I was here, the last paragraph, we promise to be transparent throughout this process by remaining engaged with our valued community. One, there has been no transparency because transparency would be specificity. Two, by all the legislative delegations' comments, there's been no real engagement yet. So the use of the word remaining is disingenuous. However, that's not the most disingenuous thing in this correspondence put out by the hospital. Testimony delivered by UMass Memorial Health on the closure of Health Alliance Clinton's inpatient maternity unit. Next to the last paragraph, we are tailoring this assessment to reduce disparities and focus on those in our community who are most at risk of negative health outcomes. In doing so, we hope to address needs that may include improving transportation options, reducing barriers to care, and enhancing community-based resources that provide culturally and linguistically appropriate and responsive whole person care. Hope and may. What about will and want? Will and want, not hope and may. 2 months later. So as you, the Department of Public Health, that's your charge. That's your mandate. The will and the want, not the hope and the may. Thank you very much.
Thank you. Karen?
Dr. Karen Darakananda, K-A-R-I-N-D-A-R-A-K-A-N-A-N-D-A. I am a resident physician training at UMass Fitchburg Family Medicine Program. I wasn't planning on speaking, but I was just reminded by a good friend that's my duty to advocate for my patients. I do not speak for the residency program or the Fitchburg family practice. This is my own opinion. I'm very proud to be a UMass Family Med resident. I'm even more proud to be part of the Fitchburg program, serving and learning at both Health Alliance Leominster and Worcester campuses. It has been my great honor and joy working and learning from the nurses and OB providers at Leominster Hospital. I'm fondly known there as Little K, or when I do really well, Special K. Before May, I was always excited to tell a patient who wanted a child that they are pregnant. But now I am terrified for that conversation. I'm frustrated that we have to tell our patients that we can continue to provide their prenatal care. However, they have to deliver at Worcester. We have patients who have a history of delivering within minutes of going into labor. Most of our patients don't have their own transportation. We have patients that wanted us to deliver their babies, not another provider at Worcester. What should we do in this case? We are at the point where a patient jokingly said to me that the residents should take shifts along the highway because of the deliveries that won't make it to Worcester. Yes, there has been deliveries in the ED, as you have heard, but without the experience of the labor and delivery nurses and the obstetricians who are sprinting from the third floor down to the ED, it would have been easily disastrous, and sometimes it has been. I'm scared for the night call where I have to deliver without the amazing L&D team and being responsible for 2 patients at their most vulnerable time. This team is irreplaceable. I'm not a seasoned doctor. I don't have the responsibilities that the administrative providers have. I can't imagine the difficult discussions that led to this decision. And to be honest, I don't think UMass is the real problem. This is a systemic problem across the nation where women and children historically and currently are not properly prioritized. And we don't need to be part of the problem. Thank you.
Thank you. Our next speaker is Emily Barr.
Hi, good evening. My name is Emily, E-M-I-L-Y. Last name is Barr, B-A-R-R. I, like my colleagues, I'm a family medicine resident at Leominster Hospital. These are my own opinions. I am the daughter of an OBGYN and have been surrounded by women's health as far as I can remember. I was on L&D on the dark day in May when they announced the closure. Fast forward to a couple of weeks ago when I was on the family medicine inpatient service and responded to a code white page to the ED. We all rushed down there and a woman was being wheeled in who was crowning. We were the ones there to deliver the baby. While I respect my ED colleagues, they are not ready for what is to come. As a resident, we will be forced to be put in precarious situations where we will be delivering babies in the ED with ED physicians overseeing us. Yet they just don't have enough training. This will lead to maternal and fetal mortality. I have no doubts, and this terrifies me. The reason the delivery went well was that we had the L&D nurses who were there coaching the patient, and the pediatrician was at the warmer, all hands on deck. These are the team members who will not be there come September. I'm scared for what's to come when I'm doing nights and we just don't have the team there. What will we do? Who do we call? I don't have those answers for you. Thank you for your time.
Thank you. That's the end of those who have signed in. We have less than 10 minutes left before the hotel is going to shut us down. Is there anyone else who needs to speak before this ends? And could I ask that you say and spell your name, please?
My name is Molly Velasco, Molly, V as in Victor, ELA, S as in Sam, CO. Good evening, everyone. I absolutely did not plan to speak tonight. I came in support of something that I think is really important. I work for a local nonprofit that focuses on food security and nutrition security in the North Central Mass region, and we help all 27 towns that are in this community. And we focus on health all the time. And I work with another organization called HEAL, which focuses on health in Gardner and in Winchendon. And what I've learned from my time working in this North Central Mass community, which has been the last 3 years, and I've dedicated almost every single moment of those last 3 years to serving this community, is about empowering people, economic empowerment, healthy food access, and social inclusion. And what I've learned about empowering a community is taking away health and social services does not lead to good outcomes. I'm 31 and I have not given birth. I am ill-equipped to actually tell you what that experience is like other than what my friends have told me, and it's slightly horrifying and terrifying, to be honest. And I will say one thing. I have a friend who recently had my nephew on June 10th, and while I love this for her, I don't love it if the hospital is 30 minutes away. She was in labor for 17 minutes. They almost didn't make it to the hospital. And if she had to travel 30 minutes, she wouldn't have made it. I also know that I have a beautiful, beautiful nephew named Waylon Edgar, and he would not be here today if it wasn't for Leominster L&D existing, because he was born a month and a half early. And he is beautiful and healthy and brings so much joy to our lives and my lives as his Nina. That's what he calls me, Madrina. It's godmother in Spanish for those of you that don't know. And if I did not have that love in my life, I would not be where I am today. And there are so many women in our community that won't have access to basic health care. That is terrifying. In a country where birthing people, folks, are being forced to give birth, and we don't know what's going to happen in the next year, month, 2 years. No one thought that we were going to be losing rights this year. I certainly did not. And to then find out that we are closing down services for people in a country where we are already losing our rights, and now we're going to lose basic health care. And I think an amazing person said that it is going to affect not only people who are birthing, it is also going to impact people like me, because OBGYNs are going to leave. Preventative care will not be in existence. And as somebody who is entering a time in her life where multiple friends have been diagnosed because of preventative health care and basic health care checks, they would not have the opportunity to receive treatment in time. They would not make the time to go and seek treatment in Worcester. I work for a nonprofit. It's everything everyone says. It is super fulfilling. It brings so much value to my life. It is under-benefited and underpaid, and I am under-resourced. We don't have time. I barely have time to go to the doctor, let alone travel to Worcester or Boston or where else I can get culturally competent health care. So this is going to affect so much more than just women who are giving birth and birthing people. It is also going to impact those families. As somebody who has lost parents, it is going to impact people outside of those giving birth. When the mother and the child and the birthing parent die because this closure goes forward, it's going to impact the kids they already have, the kids they could have had, their parents, their spouse, their partner. This isn't just about one person. This isn't just a dollar sign. This is about actual human beings This is about actual human beings in this room. It's also about the nurses. My mother is in her 65th year of nursing, not at Leominster, but she was an ICU nurse and ER nurse forever. I was raised by nurses. I was raised by her friends who are nurses. All her best friends are nurses. I've been surrounded by nurses my whole life. They work so hard at their specialty. They are more competent than most doctors. No offense. I appreciate you all too. But really, like, they're the ones, my mom said, as a nurse in the ER, in the ICU, she was coaching residents on how to actually do their job. They're the ones that train them. So if they're not there, you just heard from a bunch of residents that are talking about how they are coached by nurses. They are taken care of by nurses. They have no idea what they're doing. And you want to take the people that know what they're doing away? You want to leave women and children without access to health care? It doesn't make sense. There's not one person that stood up here since I got here, and I got here a little bit late, that said, this is a good idea. There's not one person. There's not one person from the community that was like, this is a great idea. This is going to lead to more health. This is going to lead to a stronger community. This is going to lead to a safer community. Oh, it's so frustrating. But as your purview, you can stop it. You can save our community. You can save North Central Mass. Because like one of the officials said, this doesn't only impact people's lives. It also impacts people wanting to move to this region. It also impacts businesses that want to come to this region. It impacts the local economy. It impacts everything. And so I really, really would urge you to reconsider and intervene, because that is what you are here to do. Thank you.
Thank you. At this time, we are concluding tonight's hearing. Thank you for taking the time to share your comments and concerns. As I indicated earlier, based on our review of the evidence provided today, the comments submitted by fax or email, as well as the current utilization of these services, the capacity of alternate sites to provide the service, and other relevant information available, the department will make a determination as to whether the services to be discontinued are necessary for preserving access and health status in the hospital's service area. Again, we will be accepting written comments to HFL license action, all one word, at mass.gov until tomorrow at noon. The department will make its determination within 15 days of today's hearing and notify UMass Memorial Health Alliance Clinton Hospital, Inc. of its findings in writing. Thank you again for taking the time to share your comments and concerns. Have a good night.